I'm very grateful to see all the participants join us, almost 100 in the WebEx platform now. Before we start our symposium for today, we would like to share again our national anthems for Malaysia as well as Russia. And finally, we will share our University Malaysia Sarawak song also. Enjoy. Thank you.
No sound.
Assalamualaikum, good morning, good evening to all speakers and participants from Malaysia as well as Russia. Today, as you all know, today is our second day symposium, Anatomical and Allied Health Sciences between Malaysia and Russia. Welcome to all participants. For those who are joining us early just now, we already play a few songs, actually from Sarawak. It's our Borneo song for all the participants. Before we begin, probably I can introduce myself first. I'm Dr. Shalina Ahmad Razali. I'm medical educationist from UNIMAS, University Malaysia Sarawak, from West Malaysia. I would like to share a few of our objectives as well as our tentative for today. As we all know that our symposium we started yesterday afternoon for Malaysia time and morning from Russia time, entitled Anatomical and Allied Health Sciences Symposium 2022. This is combined of medical education in Malaysia as well as Russia. We're using a few platforms. Today we are using Webex. Also, we're having a Facebook Live as well as YouTube from our Faculty of Medicine and Health Sciences from UNIMAS. I would like to share the beginning of the uh, initiation of this initiative of this symposium is between MOA and MOU between Russia and Malaysia medical universities. I hope this symposium not only the first and the last one. The most important objectives for this symposium that I like to share to all participants, the objectives of the Anatomical and Allied Health Sciences Symposium are to update on the knowledge among the medical academicians regarding medical education in Malaysia as well as Russia, and to strengthen collaboration and networking between UNIMAS and other universities in Malaysia and Russia. For recapitulation, for those who just joined us for today, actually we already started yesterday. We have a few honest guests from Malaysia as well as Russia that are happy receiving our invitation to have our welcoming speech. And then we have yesterday about 5 plenaries, uh, topic entitled PBL, and then updates on preclinical medical training in Russia and Malaysia. Also, we have our invited medical education from UNIZA from Malaysia, effective strategies in teaching and learning, as well as our Professor Dr. Sergey regarding the personification of undergraduate medical education. For yesterday and today, actually, we already swapped the plenary between Prof. Dr. Larissa, role of students Olympiads in undergraduate medical education will bring for today. Okay. For today, our second day of symposium, we have our total is about 6 plenaries. Okay, we will begin with the plenary 6 around 1:30 later for Malaysian time. About 5 minutes more from our Dr. Nurman Yaman from University Kebangsaan Malaysia UKM, entitled Integrated Medical Curriculum in Malaysian Universities, followed by our Associate Professor Dr. Siti Nurma Hanim Rais Hadi with title or topic The Future Directions of Anatomy Education in Malaysia from University Science Malaysia, followed by actually we saw yesterday Professor Dr. Larissa, role of students Olympiads in undergraduate medical education. Our fourth plenary for today by Professor Dr. Akush Nazarian. She will share on Pirogov anatomical table in anatomy, teaching and learning. She's from Samara State Medical University, Russia. After that, we also have our medical lecturer from UNIMAS, Dr. Angela Siner. She also will be shared on undergraduate medical student research projects of UNIMAS. Last but not least, we will have our assistant professor, Dr. Daniel Lipo. He will talk on role of students research in undergraduate medical education in Russia. Finally, we will have our closing ceremony by our Dean, Faculty of Medicine and Health Sciences, Professor Dr. Asri bin Said. Okay. Hopefully, for today, we have smooth internet connectivity and for Malaysia and Russia. For today, if any for any question, you can type in the chat box or unmute your mic at the end of the plenary. Hope if we have time, we can ask directly to the speaker. However, if we don't have enough time for the all question and answer, we will request from the speaker to share their email address. Thank you. Now, I would like to just remind about the housekeeping for today's symposium. Number one, I think it's very simple. I hope we can meet ourselves during the symposium to let our distinguished speaker to share their content or presentation. And then if you have any question, you can type in our chat box. However, if you at the end of the session, if you would like to unmute yourself, you can unmute and then directly ask the speaker. Other than that, I think we also will display the attendance and feedback link at the end of the symposium. For UNIMAS staff, we will share the QR code attendance at the end of the symposium. Finally, for the e-certificate, with our team, our organizer team will send via email after 2 weeks of the symposium. Okay. Maybe I would like to check for other visual our first speaker, Dr. Nurman. Before we begin our symposium. Assalamualaikum and good evening, Dr. Nurman. Can you hear my voice?
Assalamualaikum, Waalaikumsalam. Yes, I can feel you here.
How
Can
are
you hear me
you?
well?
Happy Ramadan.
Happy Ramadan.
Okay. Dr.
Alhamdulillah.
Nurman, you want to share your presentation for visual test? Your audio okay? Thank
Let
you.
me test, huh? Okay.
Yes.
Okay.
Okay, if Dr. Nurman ready and all participants ready, are you ready, Dr. Nurman, to share your presentation for today?
Inshallah.
InsyaAllah. Okay. With kalam Bismillahirrahmanirrahim, we begin the symposium for second day today. So I would like to read Dr. Nurman Yaman CV first before he share the presentation. Dr. Mohammad Rumayaman, he is the head of department, senior lecturer, Department of Kebangsaan Malaysia Medical Centre, UKM. He obtained his MB 2003 from University of Sheffield, United Kingdom, Master in Medical Education in 2011, and Doctor of Philosophy in Medical Education in 2003 from University Kebangsaan Malaysia. He has teaching experience in Teach Postgraduate Master in Medical Education and undergraduate from Medical Doctor University Kebangsaan Malaysia. He supervised about 2 postgraduate Doctor of Philosophy doctorate, 5 postgraduate master and undergraduate students. Without further ado, I would like to welcome our first plenary speaker for today, Dr. Nurma Yaman from University Kebangsaan Malaysia. Kindly welcome. Thank you.
Okay, thank you very much for the kind introduction, Dr. Chas. Assalamualaikum warahmatullahi wabarakatuh, everyone. I hope that good afternoon in Malaysia and good morning in Russia. Basically nice to be like virtually to UNIMAS. So let me share my slide. Okay, you guys can see it clearly. Okay, so the topic given by the organizer. First of all, I would like to thank the organizer for inviting me for this session today, giving some sharing. Basically, I would like to share some information regarding this integrated medical curriculum in Malaysian University. So, as what Dr. Shai said, I'm from Department of Medical Education, Faculty of Medicine, UKM. For our fellow colleagues from Russia, UKM is University Kebangsaan Malaysia, or in English is the National University of Malaysia. So the content of my talk today is more, this is quite simple, straightforward. It will be some sort of introduction. I will mention about the standard for undergraduate medical education in Malaysia. He gives some brief info on traditional and also integrated medical curriculum, some pros and cons, and the conclusion. So first of all, just a disclaimer, the content of this presentation and the following slides are solely of myself as a medical educationist and not actually of those undergraduate education faculty of medical education committee in MMC and faculty of medicine. As an introduction, medical curriculum in Malaysia, I would say Federation of Malaya, when it first began. The first medical school in Malaya was established in Singapore. At the time, it was in one location, we call it Federation of Malaya, in 1905. It was located, unfortunately, in a lunatic asylum called Straits and Federated Malay States Government Medical Schools. And then since then, a lot of things happened where it was created in Singapore and everything. And first medical school in Malaysia is the Faculty of Medicine of the University of Malaya. It was created in 1963 with the first group of 40 students in May 1963. University of Malaya, or conducted their medical program as the preclinical and critical phases with multidisciplinary approach. And they named the curriculum as preventive medicine curriculum, which lasted for 5 years. Second medical school is UKM, where I'm currently working in 1972, Faculty of Medicine, University Kebangsaan Malaysia, where 44 students are the first cohort registered in May 1973. We also quite similar to where we have preclinical and clinical phases. The one different is initially at the beginning of the curriculum, it was conducted in Malay language and English language, where the preclinical will be conducted in Malay and clinical will be English at the beginning. Nowadays, they all are conducted in English. And the third medical school is from University Science Malaysia in 1979. And the first cohort in USM, because USM is in 1981. And USM is the first medical school using PBL, Program Measurement as Teaching Methodology. Based on Second Schedule Medical Act 1971 from the Medical Council, currently we have 31 medical schools in Malaysia. If I'm not mistaken, I did count about 37 medical program provided by the medical schools from Malaysia. So just to talk a bit about standard for undergraduate medical education. In Malaysia, we have a standard. Previously, we called it a guideline. So the guideline of undergraduate medical education usually is how to create a medical school. And in view of recent changes from the World Federation of Education, in 2019, the first edition came out, the standards for undergraduate medical education, and recently the second edition in 2022 is an updated version. This quality assurance is by National Medical Council for continuous quality improvement for our undergraduate medical program in Malaysia. It consists of things like accreditation, curriculum development, and how do we do curriculum review. And the new thing basically is the core competencies that must be achieved by all graduates all medical students upon graduating from medical school in Malaysia. And this document need to be read together with the other Malaysian Qualification Agency document, such as Malaysian Qualification Framework. This MQF is the one I determine the level of qualification in Malaysia. COPIA is Code of Practice Institution Accreditation, where the institution that providing the medical program must be accredited. COPA is the program accreditation, Code of Practice program accreditation, guidelines to good practice, and lastly is the Minister of Higher Education Quality Assurance Policy. So all this must be followed by all registered higher education in Malaysia in order to run any program. But for medical school, we'll be having the standards for undergraduate. So talking about traditional medical curriculum is mainly a didactic teaching with passive learning style, where most of it are discipline or subject based. The examples given by Mohammad Rumayaman and Basu was preclinical, basically subjects like biochemistry, biology, statistics, and so on and so forth. This one actually reminded me during my first year and second year, where we go through the anatomy, physiology, lectures, anatomy, dissecting lab, and everything. And then for clinical, it's basically box standard general medicine, cardiology, general surgery, so on and so forth, orthopedics, pathology, neurology. So all the clinical specialty, and it's a standard uh, curriculum for the clinical. And it can be represented by what we call a TIDHH. It doesn't represent can be pronounced something special, but it's a basically is a T is for teacher centered, I is information gathering, D is discipline or subject based, H is hospital based, S is a standard program, A is apprenticeship or opportunistic based. So basically, it's a teacher-centered. The lecturer is the one that become the boss of the session, and they will be giving the information. So the student will mainly gather information based on the discipline given. Most of the time, it is a hospital-based, just like in the clinical, medicine, they all are in hospital, and all the program are quite standard for all topics. And the last thing is apprenticeship or opportunistic base means that it depends on who you will attach to. If you're attached to a superb consultant, most of the time you have a superb teaching and learning. But sometimes if you have a strict consultant, then you will basically portray the strictness as you go and progress into your medical career. So that's about traditional medical curriculum. In terms of integrated curriculum, first it was described in Ron Harden in 1984, and now it is supported by many medical education organizations the whole world, in the US, UK, Australia, and Asia, such as the World Federation of Medical Education, the Federation of International Medical Education Research, Association of Medical Education in Europe, ASME, and everything, all the Asia Pacific, ASEAN, and everything, all are supporting the integrated medical curriculum. And this integrated medical curriculum establishes significant linkage between the subjects or the skills that are mainly addressing various subject areas to improve of learning experiences of the medical students. And this is also allows some opportunities for all the stakeholders of the program to think outside the box in order to make the curriculum much more either more effective and more interesting. So Ron Hayden introduced what called a SPICES model, where S is student-centered, P is problem-based, I is integrated, C is community-based, E electives, and S is systematic. I will explain about the SPICES model after this. Okay, okay. S, student-centered. Basically, it's a student as the central figure, where we depend, basically, we focus on the student. And how about us as educators? Our role as educators will be most of the time will be facilitator. And the student will decide and be responsible of on learning processes and approaches. Hopefully, with this student-centered, the student will try to initiate active learning, and they will need to achieve sets of learning outcomes at one pace, but within the specified time. And the student will undergo multiple teaching learning methodologies rather than just traditional lecture. They will have a lot of methodologies, groups, seminar, bedside teaching. Even now, with the past 2 years of COVID, even the online group, online teaching, and everything. So the benefit of this student center is it can increase students' motivation, and it's a one way to prepare the student to continue their postgraduate education. Second is P, so it's a problem based where the curriculum will use problem uh, as a vehicle to develop a usable body of integrated knowledge. As we know, patient doesn't come with diagnosis. For example, patient just come to the emergency, or I have malaria, or I have COVID. No, they will come with fever. So for the past 2 years, anybody come with fever, it is COVID unless proven otherwise, because we know the majority at that time, and for the past 2 years, any fever, we have to rule out COVID as the fever as the problem. So with that, the student can develop a problem-solving skill and also tackling patient's problem. It's not only patient problems, it can also health delivery problems, medical science problem, or even a research problems. This problem base will integrate both basic science knowledge that usually mainly taught in the practical years with clinical knowledge to solve patient problems, and definitely will seek active participation among the students. And with this problem base, definitely feedback is very, very important. So feedback either to the student or as well as to the institution and the lecturer. And one benefit from this problem base is dealing with overcrowded curriculum. In terms of overcrowded, let's say for example, we take anatomy as a subject. People will learn everything from the end of the hair until the end of the toe, everything. But then obviously for 5 years, I believe it's not enough time to complete all the anatomy topics. There is only one, but how about the biochemistry of the tissue and everything? So by having a problem, let's say fever, as I mentioned earlier, so the fever, there will be some sort of physiology about fever. The anatomy might be a very little, pharmacology of treatment of fever, and some clinical, whether it's a medical or infection or pathology, everything. So this is one way of dealing with overcrowded curriculum. Next is integrated teaching, where it will involve an organization of teaching methods to interrelate or unify subjects frequently taught. Because there are some subjects that are being taught frequently that at the end of the day, it actually means the same thing. If, for example, just take the fever. Fever can be a lot of involve a lot of department, a lot of subjects, biochemistry, pharmacology, medicine, even surgical pathology. So with this, put it integrated into one, it can bring the subject together as a meaningful whole subject. This can be done either horizontally or vertical integration. Horizontally means that you do it within the same level, basic science or basic science, or vertical integration where you involve the clinical colleagues into the subject. The benefit of this is to reduce the fragmentation of the courses. It also can motivate and motivate students, as well as shaping the students' attitude to be more problem-based approach, and definitely improve educational effectiveness, and also can able to achieve higher level of objective. When we have integrated curriculum, they will promote staff communication, because staff will need to communicate with other department in order to fulfill the requirement, or to achieve the learning objective. And there will be rationalization of teaching resources, rather than having a single anatomy lab on the biochemistry lab on the. So you will need on the multidisciplinary lab. They can be used to teach the integrated module. Next is community-based, where training in the community setting, either general practice, health clinic, or hospitals, will involve some learning in health services. Students also learn about the social and economic aspect of our people, especially in Malaysia, where this student will see problems outside the hospital setting. And furthermore, the student can also do some sort of health promotion. And the benefit of this is basically to provide community orientation and learning experience. And the community do have untapped resources. And with this community base, students will know more about the healthcare system. And when they do more about this healthcare system, the active learning process will be happening. Next is the elective. This means that the curriculum is quite flexible, and having a student to opportunity to learn certain subject in depth. This can be done as intercalated years, or some medical school we take about 2 to 3 2 to 4 weeks out of the curriculum to do this elective. And the benefit is obviously coping with the overcrowded curriculum. The student will be more responsible of their own learning. It definitely can face challenges because the student will do the student subject on their interest. It will basically expect students' individual expression and some of attitude change. And lastly, when you have all these student factor integrated elective community, it's become a very systematic approach where the group that are responsible for this curriculum committee will have to create some suitable rotation in order to fulfill the learning outcome. And some of it I will be using the notebooks and also assessment system. And with this, the student will learn variety and the range of health problems and rationalization of competencies and time can be done because we only have 5 years to complete. And if you ask every educator, they want all the time that they want. Obviously, we sometimes the top management need to decide how much time that one specialty need and how long and how short that can fulfill the outcome of the medical curriculum. So this is the short diagram regarding the spices model versus traditional, or the spices on the left and the traditional on the right. Bearing in mind, the integrated curriculum basically is not fully on the left side, all the spices, but it can also have a balance to some component on the right side. For example, maybe for the student-centered because we are looking at the outcome. For institution, maybe use problem-based learning as a method, but some also still use information-based learning. The I definitely, some will use integrated maybe in the preclinical, and some will use the discipline-based in during the clinical years, and C, obviously, the community focus or hospital focus. This is sometimes it happen in where the medical school have a hospital, the tendency is more on the hospital focus, and whereas this is my personal experience, where if the medical school doesn't have its own hospital, it's more on community focus. And the next is the elective and core, either use a standardized curriculum, and last is a systematic or apprenticeship. Sometimes you can combine the systematic and apprenticeship. So meaning that you appoint certain a consultant that have a very good, basically it's a model in terms of teaching and learning to be involved in the systematic curriculum. So basically you can be in the middle, but might not be all on the left side as fully integrated. This is, for example, for cardiovascular system. Obviously, for cardiovascular, there will be issues that, the student need to learn physiology, all the active potential, all the QRS complex, the ECG. And when it comes to ECG, there'll be the medicine have to come in to identify the ECG. And the heart doesn't only involve medicine, but also surgery, the cardiothoracic. And when they involve some radiology is where, for example, in medicine, obviously the angiogram will involve the radiology team, and where is there's some disease, obviously the pathology, and lastly is therapeutics where the pharmacology comes in. So this is where the integrated is. This is example from Ron Harden, and this is example from my institution. For example, tissue body module was introduced in year 1, semester 1, where the discipline involve anatomy, biochemistry, and some clinical department. This is basically we call it mixed horizontal and vertical discipline. In the anatomy and biochemistry will be horizontal, but for us in the PBL topics, Archimedes involve the clinical department. Even a pint of blood involve the pathology, so it become a vertical integration. An example for the second module is our clinical science module. It was introduced in second semester of year 2. This is fully vertical integration where it involves the clinical discipline. For this module is medicine, surgery, orthopedic, and ONG, and many topics around the history taking and physical examination. So this table is a simplified version of the main features between integrated curriculum and curriculum. In terms of teaching methodologies, integrated curriculum various methodologies, seminars, role-play, people cases, presentation, demonstration, visits, while traditional more on didactic lectures. In terms of disciplines for teaching, integrated will be multidisciplinary, and traditional will be discipline-based. And in integrated, we will have more interactive interactive session in integrated compared to traditional. The student will definitely be more active integrated and have a better exposure to clinical cases. In terms of progression, student in integrated curriculum will know the concept of the knowledge with clinical application across basic and applied sciences. And traditional, as the basically is overloaded with all the discipline-based topics, they tend to forget basic sciences when they're clinical years, and they have some difficulties. I'm not saying that they do have some difficulties when in the clinical years. And in terms of teaching load, integrated is more relevant and based on learning outcomes, while traditional, most of the time, it will be overloaded with the topics, and some subjects are quite irrelevant. If you go back to the standard of undergraduate medical education, we have the core competency. So the core competency is what are the competencies that must be achieved by the medical graduate upon graduation in order to be a safe and competent housemanship at that level. So obviously, it is core competency based and relevance and based on the learning outcome. So they just cannot learn everything under the sun because 5 years is very short, and their expectation is to be a safe housemanship, not a specialist at that time. So, the last slide, just want to share 12 tips for developing integrated curriculum. This is written by Prof. Alam Shah Malik and Rosana Malik in 2011. Number one, when you have if you want to start an integrated curriculum, number one, you must train your staff. You must train and train them to know what are integrated curriculum. And secondly, once you have a trend, you make a committee for the curriculum committee. Then the committee need to decide the scope of integration, the level of integration, and the type of integration, whether you want to be vertical, horizontal, or mixed. Then this committee will establish working groups and distribute their responsibilities. And this group as well, with their own working groups, they will have to determine the outcomes for the subject up in I would say the topic that they want to teach, by identifying the content, the knowledge, the skills, and the attitude. From that, they will create the teams, and with that, with the 5 years timetable, they need to create a comprehensive timetable. Who will get the most time? We get this time. Who get some time? And after all the content of the curriculum has been created, then the assessment method must come together. And after that, you need to communicate to the students and the staff. And lastly, it's very, very important, it's a C2I process where the committee, the institution need to re-evaluate, evaluate, and revise the curriculum. That's why the latest standard include the curriculum review component so that everyone will improve the curriculum for the future. So lastly, I would say integration is the future of the curriculum, is the way forward, but it depends on the medical school whether you want to be fully integrated curriculum or mixed integrated with traditional curriculum. It depends on the capability of each medical school. Whatever you choose, review and evaluation must be done, because we cannot keep the same curriculum that was done like 30 years ago and done it today. It will become obsolete. In order to produce a better medical graduate. And furthermore, this integrated curriculum will definitely is learning outcome oriented, and you must involve stakeholders because they are the one who will be involved in this the product of the medical curriculum. For example, the hospital, parents, patients, because parents will ask, they want to send the student to the medical school. The hospital will want to know whether the graduate is kind of safe or competent in terms of treating, and even the patient itself, they want to know that the medical practitioner is up to date with the medical practice at present. For example, the pre-COVID is, I would say, different compared to what we have gone after the past 2 years with COVID. Obviously, as I said earlier, last time fever, especially, is just a simple infection. But now, if someone has fever, the first thing that you will thought of is COVID. Is it COVID or not COVID? If COVID positive, it will be a COVID pathway. If for COVID negative, it will be alternative pathway. So that's how in order to create a fully learning outcome-oriented stakeholders involvement integrated curriculum. So I hope that I have covered in about 30 minutes, Shaz. So thank you very much for the invitation. Hopefully, it is quite benefit. And if anyone have any question, please feel free to ask. Thank you very much.
Thank you very much to our Associate Professor Dr. Nurman from University Kebangsaan Malaysia for the kind sharing. For all our participants, if you have any question, you can type in the chat box, or else you can also unmute yourself, then can directly ask the question to Associate Professor Dr. Nurman. While waiting for the participant to ask question, maybe I would like to ask Associate Professor Dr. Nurman. So what, based on your experience for University Kebangsaan Malaysia, since we are in Malaysia already transition from pandemic, what the other challenge from the clinical years for Dr. Nurman?
Sorry, can you repeat the last part?
Oh, sorry. Since we are knowing that Malaysia transited from pandemic to endemic, what is more on the clinical years challenge for your medical school?
Okay, for us, because as we know, medical school should be the pioneer in handling COVID. That's number one that we must do, because it's handled by government Ministry of Health. So basically, we as medical institution, we have the policies are all, because of the great minds of health in Malaysia, in the ministry and as in the institution. So if you ask me, with the current situation, face-to-face, especially for clinical, obviously you cannot learn how to palpate patient by online, definitely. So that is for clinical. But with COVID for the past 2 years, I really hope that everyone will have learned something from COVID. What we learned is basically the digital education, the possibility of the digital education. Sometimes, if we refer back to our timetable, they definitely will have 1 hour of lecture, and then continue with another 1 hour of lecture, then continue with another 1 hour lecture. But during COVID, we can do it online. So, but obviously doing interactive lecture face-to-face online, it will defeat the purpose of what we learned from COVID. So what you can do basically is try to compress, do what we call flip classroom. So you provide all the teaching materials and everything. So maybe, let's say maybe 5 or 7 lectures, you do some sort of package, and then you need only maybe 1 or 2 lectures to call up the student. Rather than giving lectures, it's more like interactive lectures, more on the enforcement of knowledge or clarification of things that the student need to know. So hopefully that's what hopefully happening now. We have to learn something from COVID. We shouldn't be back pre-COVID.
For your
I think there is a
Dr. Nurman, we have
question
one
here.
participant ask question in the chat box. From Marina asking, how many schools out of 31 have PBL and integrated curriculum?
I don't have the actual number, but majority have the integrated. If we see from the history, the big three is the UKM, and USM. All three using, I would say, integrated curriculum, mainly integrated with mixed subject base. So most of it are using. In terms of PBL, USM is the first one. We also use PBL. I think most of the new medical schools, either they follow USM, and UKM, and then some of them, they will improve along the years. And then I think UNIMAS also using PBL, but different type of approach of PBL, because we have a lot of approaches. So mainly I would say in Malaysia, I say almost all is problem based. I think almost all is problem based, if I'm mistaken. If not all, it'll be majority. But I don't know. I don't have the actual number.
Thank you, Dr. Nurman, for your kind response to the question and answer. Probably later, for those participants who would like to ask more questions, our technical team will share Associate Professor Dr. Nurman question in the chat box. Okay, is it okay? Now, thank you very much, Dr. Nurman, for your kind sharing as well as experience in the medical school. For all participants and all speakers, we would like to have our photo group session as our record and as well as for the symposium of second day. For those who just joined us for today, probably we can have our participant and speaker to on for a while your video for this session. Is it okay? Okay. Our technical team, Mr. Romina, will count with 1, 2, 3, and then everybody, your big smile.
Okay, so I'm sorry I haven't get everyone the camera on yet. So please on your camera. Okay, we are still waiting for the rest to on the camera. So I guess we have 197 participants, but I don't get 197 camera. Okay, I'll get the first shot. So everyone can just wave your hand. Okay, just wave your hand for a while. Thank you. Now for the next group. Okay, just continue to wave your hand.
We don't know we in the first group or second group.
It's okay. You just wave your hand. Yes, I can see Madam Tede. Hello. Yeah. All right. So this will be the other group. Yeah. Oh, I can get the camera on. I guess I have everyone on the screen, but only the name here, except for the one those who already on the camera. Thank you very much. Hope to see you guys again. Bye bye.
Okay, thank you.
Okay. Thank you, Mr. Robina, and thank you to all speakers and participants for your cooperation to on the video, on the camera. So, we would like to have our second plenary for today from Kelantan, University Science Malaysia. Before that, I will read her CV for all the participants. Associate Professor Dr. Siti Nurmahanim Hadi, she is Head of Anatomy Department and Anatomy Education Course, GM 504, Coordinator School of Medical Sciences, University Science Malaysia. She obtained her MD in 2005 from University Kebangsaan Malaysia, the Master Science in Medical Anatomy in 2010, and PhD in Medical Education in 2017 from University Science Malaysia. Her teaching experience teach gross anatomy, neuroanatomy, histology, and embryology, supervised PhD and master candidates in anatomy education and research. She also supervising and mentoring 7 PhD students and 5 Master of Science students in more than 50 undergraduate students. Her field of specialization are anatomy education, cognitive lab theory-based teaching, teaching methodology, and histology and histomorphometry. Okay, so I would like to welcome our second plenary speaker, Associate Professor Dr. Siti Nurmahanim Hadi from University Science Malaysia. Kindly welcome, Prof.
Thank you so much, Dr. Shazrina, for the very kind introduction. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, good morning, everyone.
Waalaikumsalam.
Okay, so first of all, I would like to thank the organizer for inviting me to deliver this, I would say, a very mind-blowing topic, because I have to admit that I have a very challenging time to prepare for this presentation, because I felt like I was doing a scenario planning. That was what I felt while preparing this presentation. And I hope I can do justice, and I hope I can summarize everything within 30 minutes, inshallah. All right. Okay, first of all, let me bring you all to revisit the historical timeline of anatomy education in Malaysia. In fact, Dr. Norman has made my task easier because some of the input has been mentioned by Dr. Norman. Okay, and secondly, I would like to bring you all to reflect on the current anatomy education scenario in Malaysia. And then we're going to explore the gaps or the needs of anatomy education. And from there, we're going to envision the future anatomy education in Malaysia. All right, a bit on the historical timeline. I think everyone knows that University Malaysia is the first higher institution in Malaysia, but medical education in Malaysia began here, like what Dr. Norman said, but it was named as Straits and Federated Malay States Government Medical Schools. But after a few years, it was named as King Edward VII College of Medicine. So medical education in Peninsular Malaysia and also in Singapore, it begins here in King Edward VII College of Medicine, which is actually the parent college of University Malaya and also National University of Singapore. And basically, King Edward College was established in 1905 by the British government in Singapore. This was to cater for the shortage of medical assistant and also public health assistant in government hospital, especially in Penang and Singapore. So you can imagine that the aim was just to produce medical assistant. So that's why the curriculum is a little bit unstructured. It follows the British curriculum at that time. It still follows the British curriculum, whereby the first 2 years was reserved for the students to learn about the pure sciences subject like biology, physics, chemistry, and they also learned botany because at that time, botany was the botanical therapy was quite common and it was well practiced. So that's why we need to learn botany. And at the same time, they also learned about the basic medical subject like anatomy and physiology. And anatomy is limited only for gross anatomy. And they learned that through cadaveric dissection of cadaveric of embalmed cadavers. Right, and they also learned histology, but histology was taught under physiology, okay, because it was taught as applied sciences. There was no neuroanatomy or embryology taught in the content, right? And for the one important thing that I have to mention here, during King King Edward VII College of Medicine, there is no permanent staff except for the principals, okay, except for the principals. So you can imagine that the teachers, they are temporary staff and could not provide full guidance to the students. And then about 1962, sorry, oh, it stopped. What happened? Sorry, I share again. Okay. In 1962, the first medical schools was established in University Malaya, and this time the preclinical and clinical phase became more explicit, but anatomy was compressed, okay, because previously they learned anatomy for 2 years, okay. This time anatomy was compressed to 1.5 semesters, and apart from gross anatomy, the student also learned embryology, neuroanatomy, and also histology. And this time clinical application was introduced, okay, it was introduced. And they still learn through cadaveric dissection, but prior to cadaveric dissection, the students will also attend they attended pre-dissection lecture and clinical applied lecture, and both lectures were delivered by clinicians, mostly delivered by clinicians and surgeons. And after the dissections, okay, the students also discuss about anatomy contents in the tutorials. And about 10 years after that, the second medical schools was established in University Kebangsaan Malaysia. And like what Dr. Norman has said just now, the course is bilingual. Okay, so Malay language was used to teach anatomy. And in 1979, the medical school was established. This is in University Science Malaysia. And this is the first medical schools that use innovative curriculum, like what Dr. Norman has mentioned just now. University Science Malaysia is the first university to adopt SPICES curriculum that was introduced by Ron Harden. And because of the integrated nature of the curriculum, anatomy was horizontally and also physically, vertically integrated with other subjects. But the teaching method a bit different. We learn anatomy through lectures, practical session using cadaveric specimens and anatomy models, and also tutorials, okay, and but the students also learn anatomy through problem-based learning, right? And following that, we have another 7 medical schools, public medical schools in Malaysia, which was the latest was established in 2019, and we have about 20 private medical schools. And in general, most of the medical schools, including UM and UKM, we use integrated system. Okay, integrated meaning innovative curriculum, and a teaching method follows the USM teaching method. Basically, lectures, practical session using cadaveric specimen, anatomy models. We use anatomy models, okay, and also tutorials and also PBL. But recently, after COVID-19 struck, okay, we start to use, we begin to use anatomy software and also virtual reality. And some schools even have CBL, case-based learning, and clinical skills to teach anatomy, right? But unfortunately, there's limited opportunity for dissection because of shortage of cadavers and limited time in the medical schedule. And some private medical schools in Malaysia, they are actually international branch campus of renowned universities in the UK, Ireland, India, and also Australia. So basically, they follow the curriculum of this main branch campus. So some of these universities, they adopted the hybrid curriculum. We can see the change, the evolution from unstructured to a more structured one, which is conventional or traditional, and then it becomes integrated. So what had influenced the change? So this is the question that I'm going to answer after this. Basically, you know that there is changes here, the unstructured to conventional. It begins here, which is around after the Flexner report was out. This is around 1910. So Flexner report was written by Abraham Flexner, okay, who was commissioned by the Carnegie Foundation. And this Carnegie Foundation, they actually collaborated with councils of medical education in the US and Canada to evaluate the quality of medical education in the US. So what really happened was that there were too many medical schools at that time, okay, too many medical schools which are actually profit-based, and these medical schools were owned by medical practitioners, the doctors who were working in the government hospitals. So they want to find more profit, so they established this medical school. So apart from that, there were also increasing issues with regards to the botanical therapy, with regard to the athletic medicine. So that's why, because why? Because this botanical therapy, athletic medicine, there is no scientific, they are not scientifically proven, okay, not scientifically proven. So what happened is that Abraham Flexner went to visit all medical schools in the United States and Canada, and he actually observed what their teaching, learning, and assessment. So he actually wrote a very thick report, but I would like to summarize everything. This is what Abraham Flexner wrote in his report, also, which I think can summarize everything in the Flexner report. Okay, each day students were subjected to interminable lectures and recitations, and after a long morning of dissection or a series of quiz sections, they might sit wearily in the afternoon through 3 or 4 or even 5 lectures delivered in methodical fashions by part-time teachers. Evenings were given over to reading and preparation for recitations. If fortunate enough to gain entrance to a hospital, they observed more than participated. So from this quote, we can see that the students, they are passive learners. They learned didactically. Okay, there is lack of hands-on exposure. They have limited exposure to do hands-on activity, and again, they were taught by part-time teachers, meaning that they have lack of guidance. So because of this Flexner report, there is medical education revamp, okay? Medical education revamp happening all over the world. So what happened is that medical curriculum become more standardized, and the duration of training also was standardized. So at least 4 years, medical training was now closely adhered to the scientific method, and students who want to enter medical school, they have to fulfill some prerequisite, and medical school begin to receive full-time professors and also teachers. So they have more autonomy in guiding the students. And also medical schools also have control to clinical instructions in the hospital. So students will not need to just observe, but they can also do some clinical works and also hands-on activities. And because of this, the quality of physician has increased significantly, and medical board has instituted a rigorous regulation for medical licensure. And the medical education revamp actually has impact on anatomy education as well, because the what happened after the medical education revamp is that clinical application and integration of anatomy knowledge were introduced, were emphasized more. And but gross anatomy lost center stage in the study of medicine because we have to give way to newer experimental science subject. And because of that, anatomy teaching hours is greatly reduced, and anatomy is no longer taught by the surgeon and clinicians, but by trained anatomists. Okay, but we have this issue increasing, which is a shortage of cadavers because there are a decrease of unclaimed bodies. During that time, only unclaimed bodies were allowed to use as for cadaveric dissection. But because of it is unclaimed, it actually induced social stigma to the community, to the society. And in fact, at that time, a community preferred to donate their organ rather than donating their body for medical education. And there is also increased number of medical students, which actually with these limited bodies, it actually could not cater for the increased number of medical students. That's why there is decline in cadaveric dissection. However, surprisingly, still over 60% of the program still teach anatomy through dissection exclusively. So what actually happened in Malaysia? So I'd like to compare what happened in the past and also what we are facing right now. Okay, in the past, we are learning through conventional curriculum, traditional curriculum, subject-based, discipline-based. Currently, it's more integrated. Most of the medical schools are integrated, and our curriculum are aligned with the outcome-based education. And in terms of teaching and learning methodology, previously we learned through lecture and dissection, but at current, we are more multimodal because we use lecture, practical using prosthetic specimen, anatomy models, clinical skill, digital software, and also problem-based learning, case-based learning. The only lack here is the cadaveric dissection for undergraduate curriculum, not for postgraduate curriculum, postgraduate teaching. In human resources, previously we relied heavily on expectorate and clinicians, but currently we have increasing numbers of anatomies with medical degree and PhD, and also we also have increasing number of anatomy educationists, qualified anatomy educationists with PhD in medical education. This is because there is increased postgraduate program in anatomy and medical education. And previously, we have limited networking. There was no association to represent the Malaysian anatomies. We have limited postgraduate training. We have limited subspecialties and research opportunity. But now we have strong association, the Malaysian Anatomical Association. We have strong networking. We have experts in various subspecialties, and the researchers are spending, especially research in anatomy education. So what does the future hold to us? Okay, understand that we have to look at the gaps or the needs of anatomy education. Okay, right, I'm actually referring to this paper, which actually they conduct a need analysis in a more global context. Okay, but I'm actually aligning it with the Malaysian future higher education scenario. So there were four needs or four gaps in the current anatomy education. One is the need of incorporating the gross anatomy in clinical training, because this is important to ensure the safe clinical practice, for example, especially for the performance of invasive procedures. There's also a need to adapt rapid information explosion and technological advances, okay, because this will alter the strategic decision for new curriculum anatomy in anatomy. Okay, it will alter the way we teach students, the way we assess students because of the technology. Technology is heavily emphasized, will be heavily emphasized in the future. But because of that, we have to think a way on how to humanize anatomy education. Humanizing anatomy education is important, especially in our country, in Malaysia. We have many cultures. Okay? We are multicultural countries with many religion. So we have to consider the influence of cultures and values in our education, and not to forget about the sustainable development goal introduced by our United Nations. We have to also consider the inclusivity and equity in education. This is SDG 4. And then because we rely heavily on technology in the future, technology should lead to tolerance, respect, care, compassion, and also lifelong learning. But we must not forget about the uncertainties that we are facing now. Most of the time, we still don't know how much should we teach anatomy, okay? How detailed should we go? How to teach an anatomy effectively? Although these areas has been, there is increasing research to explore these uncertainties. However, we still could not come, the anatomists all over the world still could not come with a solid answer to answer this question. So it is important for us, at least in our context in Malaysia, to find a ways to how we can actually solve this problem together as a nation. All right. For the role of gross anatomy in clinical training, okay. So by looking at this, by looking at these four gaps, at least four gaps that I can identify for now, okay, we can actually foresee the future direction of anatomy education. Perhaps in the future, to address this gap, we must find a way to develop a competency-based education, competency-based anatomy curriculum, and to adapt to rapid information exploration technology. We have to find a way on how to develop a future-proof curriculum. Future-proof curriculum is an agile and adaptable curriculum, which can be, adaptive to any changes, any changes. For example, like previously before COVID, our curriculum does not prepare us for online teaching and learning. So that is not future-proof curriculum. But for future-proof curriculum is we mold it in a way that whatever comes in, we can still provide our education continuously to the student. So that is future-proof curriculum. And apart from that, we also need to include values-based education, because we have emphasized too much on technology in the future, not now. In the future, we'll be emphasizing much on technology. So we have to include the value-based, the human factor in our education. And to answer this question, okay, perhaps national anatomy curriculum would be the best answer. Right. But to develop a competency-based anatomy curriculum, of course, we have to understand what competency that we want the student to fulfill after they have completed our anatomy courses or program. So I would like to give an example here. This is a paper by Showman and Chandralita that was written 10 years ago, okay, in 2012, and published in Anatomical Sciences Education. They came up with 3 competencies: anatomy theory knowledge, clinical application of anatomy, and 3D practical application of anatomy. And currently in Malaysia, we have a group of Malaysian researchers comprising of anatomists, medical educationists, surgeons, and also physicians. We are actually doing this study, reconceptualizing clinical competency for safe clinical practice through anatomy education lens. And this study is supported by the Ministry of Ministry of Higher Education grant, and it's still ongoing. It is still at the early phase, but what we have come out so far is managed to come out with 2 construct of competency, which is cognitive competency and psychomotor competency. And under cognitive competency, there are 3 main domains, okay? Mastery of anatomical knowledge, basic applications of anatomy knowledge, and clinical application of anatomy knowledge. And under psychomotor competency, identification of anatomical structure, 3D visualization of anatomical structure, kinesthetic appreciation of anatomical structure, and performance of anatomy-related clinical skills. There are descriptors or items for each of these domains, but I cannot reveal it right now because the study is still ongoing. We are yet to receive many more input from many stakeholders. So once the study is completed, we will share to everyone, inshallah. Right. For the future-proof anatomy curriculum, okay, the best way to design a future-proof anatomy curriculum, we have to look at the Industrial Revolution. Because why? Industrial Revolution has direct impact to educational revolution. Now we are at the 4th Industrial Revolution, okay. Everything is about cyber physical system, Internet of Things and network. Everything is about computer algorithm, okay, automation, okay, algorithm. All right. So why Industrial Revolution influenced the education? Because of the technology. Okay, education will change because of the technology, right? So between 18th to the mid 20th century, this is the Education Revolution 1.0. So this is still didactic, okay, didactic teaching, whereby teacher is the source of information, the students are the passive recipients of the information, and teaching is mainly done in classroom setting. Okay, and At the end of 20th century to early 21st century, you can see the gap here. This is the transition period, okay, where where the education community are adapting to the technology, okay, because there's computer, electronics, and automation here. They are adapting to the technology. So at the end of 20th century to early 21st century, okay, they begin to have some sort of like technology in the teaching and learning. Okay, students begin to use technology, begin to use internet, but very limited. The contact is still in the classroom settings. Teacher is still the main source of information, but students now can also learn from their friends by using the internet. Okay, and education 3.0. This is the first decade of the century. We are not in the first decade anymore. Okay, so we are not in education 3.0, right? So education 3.0, under education 3.0 is more student-centered. Student-centered, technology is the curriculum. No, I mean the technology is the platform for teaching and learning. Okay, student plan your own learning. Okay, the tutor or the teacher is just the facilitator of learning. This is the time when open learning and also flexible learning was introduced in the system. But where are we now? Where are we now? Because we are no longer here. Are we already in education 4.0? We are actually in the transition period from education 3.0 to education 4.0. This will start mid 21st century to the future. But we are lucky enough as Malaysian because our Malaysian higher institution, Ministry of Higher Institution has actually outlined what are the criteria for education 4.0, specifically for higher education. So here the web is now as curriculum, and there will be open access of information. Learners are as content producer and sharer, learners also as teachers, the learners also as connection maker. The teachers is just like a resource guide, and the learners have access to experts all over the world because of this diversity of network. So these are the features of education 4.0 that we need to think when we want to design our future anatomy education. How to design our future-proof anatomy curriculum. These are the things that may help, okay, but if we want to do it properly, perhaps we have to sit down my anatomies, okay, and we have to think properly. But these are the things that is suggested. One is personalized remote learning. Okay, for example, like you can do MOOC, you can do micro credential. This is one example of personalized and remote learning. And then plethora of learning tools, and this learning to should leverage technology. Technology is a must. Okay, we must not ignore technology. We have to use technology, but we must not forget about the physical models, like physical models and also cadaveric specimen, because this will ensure the development of psychomotor competency. And in terms of the assessment, should be easy and accurate. Not much on the assessment of learning, the exam oriented. This should be reserved for high stake decision, but we should emphasize more on assessment for learning and also assessment as learning. Okay, because students would have more autonomy to determine their own progress. And of course, we should prepare a platform to ensure the diversity of networking for the student. Right. How to incorporate value-based education? Value-based education actually align with the industrial revolution. We are now here, IR 4.0, digitalization. Okay, about 20 years to 30 years down the line, we will face with the IR 5.0, the personalization, meaning that there will be cooperation between man and machine as human intelligence works in harmony with cognitive computing, meaning that not only high tech, not only the technology, but there is also human factor, human techno interaction, because this one we focus more on technology, but when it comes to IR 5.0, remember, we should humanize the technology. Okay, how would this IR 5.0 change the anatomy education in the next 30 years? But in terms of cognitive learning, this is what we are doing now. Okay, perhaps this will be replaced by artificial intelligence in quantum computation. Because why? Because their performance are better than human mind. And then about the psychomotor, okay, this will be partially replaced by robots. Why? Because their precision is higher than human skills. But affect effective learning, okay, we still don't know how. Okay, but one thing for sure, it should be high tech and high touch. Okay, not only the high technology is emphasized, but it should be incorporated with high touch element. So value-based education is the answer. Because why? Because it will ensure the development of character, personality, ethical thinking development, emotional, social communication skills, spiritual and moral development, and also enhancement of cultural values. So these are the things that we may want to consider when we want to incorporate value-based education in our education system. The first one is interprofessional collaboration. For example, that sorry, our medical student may want to learn anatomy together with dental student, with other allied health sciences student, or together with the professionals. So perhaps we can introduce work-based anatomy teaching. Perhaps we can also do formal teaching in clinical years, formal anatomy teaching, which is rarely done, okay, in Malaysia. Formal anatomy teaching during clinical years. And for high touch element, this can be done by combining all types of technology, artificial intelligence, augmented reality, virtual reality, and mixed reality with hands-on activities. And then we should also reintroduce the cadaveric section, okay, and also clinical skills, at least as elective. Okay, at least as elective. And for ethics and professionalism, I could not think of any except for this one, because this is the best model so far, silent mentor program. And for community outreach, perhaps we can teach anatomy by promoting body and organ awareness program, for example, and not to forget about the inclusivity and equity. Perhaps in the future, we should offer anatomy courses to the visually impaired student, okay, because they will have a better job scope after they graduated. Or perhaps we can give anatomy courses for disabled students, okay, and perhaps we should also teach anatomy of human biological variation, okay, a person with two sexes, okay, the intersex person. And we have to ensure that anatomy is accessible for all, regardless of geographical and economic factors. In terms of national anatomy curriculum, I think I have not much input on this, but one thing for sure is that there is significant variations in anatomy curriculum among institutions in Malaysia. Okay, and in terms of the teaching method, how to teach anatomy effectively, considering our economical status, okay, technological and also feasibility factors, and the content. There are too many input at the moment, too many, because it's content driven, right? We taught too many during the preclinical years. But are all input relevant for clinical practice? Or perhaps we should just focus on skills that are not replaceable by automation. All right, that is the thing that we can ask ourselves. And then in terms of the assessment method, how to design a future-proof assessment. Okay, how to assess higher order cognitive and psychomotor skills, and how to assess effective learning in anatomy. So these are the things that we should consider. It definitely need a lot of work, but it can be done. It's doable. Why is it important? Because a standardized curriculum, okay, a standardized anatomy core curriculum, okay, will address issues in monitoring the quality of the graduates. It will lessen the learning burden to the student and ensures the attainment of competencies. So this is the summary of my presentation. To look at the future, again, I think there are at least 4 important elements at this point, okay, competency-based, future-proof curriculum, value-based education, and national anatomy curriculum. And my final note, we might see that this is perhaps how we envision the future anatomy education, right? But to achieve this, it is not an easy task, because it requires proper scenario planning, it requires input and strategic actions from various stakeholders, and the process and the design of proposed learning ecosystem should the uncertainty. So we have to think very creatively. The scenario planning should be very strong. Okay, and it requires research, tons of research, lots of research for evidence-based practice. And of course, the role of Malaysian Anatomical Association is important, because why? Because they need to streamline all the work so that this can be materialized. I end my presentation with note. Thank you so much for your attention. I'm happy to accept any question. Thank you.
Thank you, Associate Professor Dr. Nurma. We have one question from our participant, Prof. Gabriel. Silent mentor program. Probably Prof will share with us what elaborate on the silent mentor program. Thank you.
Okay, the silent mentor program was actually introduced by the Zuchi medical schools in Taiwan. The program actually involves body donation programs together with clinical skills and dissection process. Meaning the body donors, they pledge to donate their body, okay, and when when the students receive the body, there would be like a proper preparation, and the students will get engaged with the families of they call the donors as silent mentor. They call the donors as silent mentor, and the student will get engaged with the families of the silent mentor, and they will learn about the life of their mentors, so that when they dissect the silent mentor, or when they do procedures on the silent mentor, they will do it in humanistic way. Meaning, and after the learning process completed, okay, they will do a proper ceremony to send off their silent mentors. So I have actually joined the program in Taiwan. It was very good. Okay, and in fact in Malaysia we also have the silent mentor program under University Malaya, if I'm not mistaken, but we are still at early stage. Yeah. I hope I answered the question.
Thank you, Prof. Siti. I also first time heard about silent mentor program.
Okay, okay. It's
Dr.
quite
Choi,
famous, I think.
asking one question more, Prof. Can you elaborate and give example of high touch and high tech?
Okay. Like perhaps at this point maybe we do not yeah, I think the silent mentor program is high tech and high touch. Oh, high touch is high touch, but at the moment not much of technology used except for the clinical skills devices that they use in the clinical skill lab. That is one examples, high tech and high touch. But we are looking forward to a more high tech, because we are not really go into high tech at this point, right? We are at least in Malaysian context, we do not really use high technology in anatomy teaching. But in the future, perhaps when we use, for example, like virtual reality, virtual simulation, when we have that, we have to couple it with perhaps cadaveric dissection. I don't know, something like that. Yes, this is something that we have to think together. Yeah. Okay.
Thank
Thank you
you
so
once
much.
again to Associate Professor Dr. Siti Nurma.
Thank you.
Probably, I think this topic is very hot topic. I think the anatomy in medical education. I also remember how we learn from anatomy and also the X-ray during the undergraduate. Then I think I hope all participants who have saw other question, I already share the Associate Professor Dr. Siti Nurma email, so you can directly email her using the snurma@usm.my, so you can have more collaboration and more understanding on the further topic. Thank you once again, Professor Nurma. Thank you for
Thank you.
accepting our invitation. Happy Eid Mubarak. Happy Eid Hari Raya.
Happy Hari Raya.
Okay, thank you. So now we will proceed with our third plenary. Before we begin, I would like to read a bit of his CV for all participants. Associate Professor Dr. Daniel Lipo, he is the Deputy Dean for International Students, Chairman of the Council of the Research Society of Young Researchers and Students, Assistant of the Department for Pathophysiology, Clinical Pathophysiology at Volgograd State Medical University in Volgograd, Russia. He obtained his medical doctor with honors 2020 from Volgograd State Medical University. Now, he pursuing his PhD in Clinical Pathophysiology at Department for Pathophysiology. His research areas of interest include the pathophysiology of female infertility and reproductive medicine. So I would like to call upon our professor to share his third plenary for today, entitled Role of Students Research in Undergraduate Medical Education in Russia. Thank you. undergraduate education in Russia. Thank you.
Good afternoon, dear colleagues. It is a great honor for me to speak at this symposium today on behalf of the Research Society of Young Researchers and students of Volgograd State Medical University. I am pleased to welcome you, and I would like to start my presentation on the role of research in higher medical education system in Russia. It is no secret that the need for highly qualified research personnel is increasing every year. This concerns absolutely all areas of human activity, from agriculture to nuclear physics. But it is particularly relevant for medical science. Why? I am convinced that the success of clinical medicine depends directly on basic research. Great medicine begins not so much at the patient's bedside as in research laboratories, because without basic discoveries, we would still be treating patients with herbal infusions and witchcrafts. Now it can be considered an axiom: young professionals are vital for us. I'm very glad that not only professional communities, but also the leadership of universities and national governments are aware of this. Various programs of social and material support for young scientists and students engaged in scientific activities exist in all countries. I'm sure that there are features in Malaysia as well. Today, the majority of research grants in Russia are targeted at young researchers. There are a large number of competitions for young researchers and students, new scholarship programs are being opened, and the scientific and academic mobility of young researchers is developing. Moreover, in order for a research group to work well and for that research group to receive substantial grants from the state funds, there must be young researchers, postgraduate or undergraduate students. Moreover, according to the Russian standard of higher education, every medical student, regardless of the university, is obliged to engage in research activities. This also applies to international students studying in Russia.
В том числе это касается и иностранных граждан, которые обучаются в России. Встает логичный вопрос, как же все-таки
So how is the research work of students organized in medical schools in Russia?
Я выделил три принципиальных блока.
I have identified three main areas of activity. First is research internships. Usually there are two internships. One in the first year when students are studying fundamental courses, and the second one in the senior year when students are studying clinical courses.
На более старших курсах, когда студенты уже входят в клинику, изучают клинические медицинские специальности. Под надзором преподавателей
Under the supervision of their professors, students undertake their first small research studies during these internships. Thus, it can be stated that almost every student has two completed research papers by the time he or she graduates. Next unit is work in your research society. Youth Research Society is an association of students and young scientists of structural divisions of university, laboratories, departments where medical research is directly conducted under the direction of the supervisor. It seems to us that the organization of such a format is very important. It is especially important because of the intergenerational succession. There is no need to separate youth research from student research. Beginner researchers, PhD postgraduate students, graduate students, academics and professors should work side by side. It is important to show students who are just beginning their journey into research that success can only be achieved through hard work.
Только
Only
трудом
through
и
it you
потом
can reach
можно
the peaks of
достигнуть
your research
вершин
career.
научной карьеры. И как пример
And as an
такого
example
успеха
of the result of
перед
this hard
студентом все
work, you
время
see
должен
professors, young
стоять
scientists,
профессор,
academicians, and
молодой
associate
ученый,
professors in
академик или
front of you every
доцент.
day.
Это очень важно, чтобы у студентов
It is
сложилась
important for
вот
students
эта
to establish
линия
a line of succession to
преемственности.
understand that
И
they can
студент
reach any
понимал,
heights through hard
что он
work.
может достичь любых высот при условии упорной работы. И третий вариант работы – это работа в настоящих
Finally,
уже
the third
исследовательских
area
группах.
is to work in real
Когда
research
студент
teams.
набирается
This is
опыта,
when the student gains
когда ему
experience,
доверяют
when they can
довольно
already be
сложную
assigned
работу,
serious work,
в том
including an
числе
independent
какое-то
study or a
самостоятельное
block of
исследование
research
или
in a
блок
large clinical or
какого-то
basic
исследования
work.
в какой-то действительно большой клинической или фундаментальной работе. Для нас, членов научного общества молодых
For
ученых и
us, as
студентов,
members of the Young Researchers
главной
and Students
задачей
Research
является
Society, the main
заинтересовать и
objective is
привлечь
to get
студентов
students interested
к
and involved
исследовательской
in
работе.
research activities.
Зачем это нужно?
Why do we need to do
Все очень
this? It's
просто.
very simple.
Если мы опросим студентов первых
If we
курсов,
conduct a survey
неважно
amongst
какого
first-year
университета,
students at any university
неважно в
in
какой
any
стране,
country, doesn't matter,
Азия,
Russia, Malaysia,
Россия,
Germany,
Египет,
most students
Германия,
will say that science does not
большинство из
interest them at all.
студентов скажут, что наука их абсолютно не интересует. Большинство студентов
For most people,
считают,
research
что
is a
научная
non-promising,
деятельность – это
low-paid work which
бесперспективная,
requires a lot of effort, both
низкооплачиваемая
professional and mental.
работа, которая требует больших усилий, как трудовых, так и моральных. Наша задача рассеять эти мифы.
Our task is to dispel its myths and to prove that science can be a highly profitable and interesting field of human activity.
Сложной, сколько интересной. И при упорной работе,
With hard work,
когда
when a
человек
person is
действительно
committed to
отдается
it,
своему
the student
делу,
can
он
reach
сможет
extraordinary
достигнуть
heights.
небывалых высот. Конечно, мы понимаем,
Of
что
course, we understand that not everyone may be
все
interested in
студенты,
this.
слава богу, наверное, хотят связать свою жизнь с наукой. В лучшем случае таких
In
будет
principle, but the main thing
5-10.
is to try to bring this to the mass of students. There are only 5 to 10% of such students. Our task is to supervise the students who want to do research. And if we see a response and interest, we try to work with these students in a targeted, personalized way.
Которые действительно хотят заниматься какими-то исследованиями. И важна в этом
It is
плане
important to build an
таргетная,
individual trajectory for each
специфицированная
student. Yes, it is
Каждым
very
студентом.
difficult. Yes, it takes a lot of time, and it is a very big
Каждому
job. But you and I should
студенту
understand
выстроить
that it is
индивидуальную
necessary for the
траекторию.
university
Да, это
and
очень
for the
сложно.
development of
Да,
science
это
in
занимает
principle.
много времени, но мы с вами должны понимать, что это необходимо для университета в первую очередь и для развития медицинской науки в принципе. Как же организована
How is student research organized at our Volgograd State Medical University?
в Волгоградском государственном медицинском университете? Какие
And
мы
what
хотели бы
features are particular
выделить
to our university?
особенности этой работы? В первую очередь, это ранняя
First of all, it
профориентация.
is early career
О наших
guidance.
профориентационных проектах я расскажу немного позже.
I will talk
Это
about our career
персональный
guidance
подход.
projects
Я
in a
уже
bit
об этом
later.
говорил.
It is a personal approach, as I have already
Персональное
mentioned. Personal
курирование
guidance to each
каждого
student.
студента. Для нас важно, чтобы студенты
It is
оставались
important to us that
в
students stay
университете,
at the university,
продолжали
continue their
учебу в
studies as
качестве
postgraduate
аспирантов,
students, and continue their
продолжали свою
further work
дальнейшую
as
работу в
teachers
качестве
and researchers.
преподавателей, в качестве научных работников. Только в этом случае
Only
мы
then will we be able to
сможем
develop both
развить и
internal university
вузовскую науку,
research
и
and
продвигать
international
в том числе
research.
мировую науку. Материальная поддержка молодых исследователей
The
и
university also
студентов,
offers
о ней мы
financial
тоже
support for
чуть-чуть
researchers
попозже
and
более
students,
подробно
which I will
остановимся. И
discuss
широкий
in more
спектр
detail later,
возможностей и доступ к
and
современному
also a
оборудованию.
wide range of opportunities
Конечно,
and access to modern
мы
equipment.
не
Of
ставим
course, we do
разницы
not separate
между
Russian and
студентами
international students.
иностранными,
We do not separate
российскими,
postgraduate
мы не
students
ставим
from
разницы
different
между
departments.
аспирантами различных кафедр. Если на какой-то кафедре есть
If some
необходимое
department
оборудование
has
для
the
проведения
necessary
исследований,
equipment to conduct
этим
research,
оборудованием могут
this equipment
пользоваться
can be used by
абсолютно
everyone.
любые исследовательские группы по предварительной договоренности, разумеется. Но это очень важно понимать, что
But it is very important to understand this. Students are not just observers of the work, they are people who are involved in research activities from an early stage.
которые непосредственно вовлечены с раннего курса в исследовательскую деятельность, в работу в лабораториях, в работу на современном оборудовании. Только таким образом мы сможем взрастить, вырастить действительно высококлассного специалиста. Особую гордость представляет наш
particularly proud of the Young Researchers School.
молодого исследователя. Это вот
It is a career guidance educational project at the Volgograd State Medical University aimed at gaining skills in research activities.
Уникальность проекта — это формат равный равному.
The project is unique in its peer-to-peer format, where the main tutors for beginner researchers are senior students who have experience in research activities.
Опыт в научно-исследовательской деятельности. На самом деле, мы одни из
We
первых
were one of the first in Russia to adopt this format. We consider this format to be very effective.
Такой формат равный равному, весьма эффективным. В 2014 году
In 2014, when we first launched this project, I entered my first year at VSMU and took this course. Only 12 people completed the training.
Прошел эту школу, ее прошли всего 12 человек. В этом году выпускниками школы
This year, 197 students have already graduated from the school.
На занятиях студенты обсуждают
During the classes, students discuss the basics of the research activities. How to start your own research, where to get sources, how to organize your work, what a scientific or medical journal is, the basics of medical statistics, how to write your first research paper, and much more.
Основы медицинской статистики, как написать свою первую научную статью. Все это студенты обсуждают.
All of this is discussed at the Young Research School.
Более того, к студентам прикрепляется
Students are also assigned a personal mentor, a tutor, who helps students write their first research paper.
Первую научно-исследовательскую работу. И своеобразным экзаменом.
But most importantly, for a student to successfully graduate from the school, he or she must write the first research paper and present it at a research conference, which incidentally is now held at our university.
И выступление с этой научной работой в рамках научной конференции, которая, кстати, проходит в эти самые часы у нас в университете.
Our experience in running this school has also been adopted by other universities across the country. On this slide, you can see the cities painted in green that have adopted our experience. Krasnodar, Rostov, Kazan, and Ulyanovsk. Our project has also won prizes several times at national and international competitions for educational projects. And we're particularly proud of the fact that in 2022, the Academic Council approved a new course, the Organization of Research.
Новая учебная дисциплина — это организация научных исследований. То есть фактически это та же самая школа молодого исследователя.
In fact, this is the same Young Researchers School, which is now officially included in the curricula of medical students.
В учебный план работы студентов лечебных специальностей. Основная задача этой дисциплины —
The main objective is to provide students with a basic understanding in research, basics of planning, conducting, and evaluating research.
И оценки научных исследований. У нас нет задачи с
We don't want to take people into laboratories and force them to do experiments from the very first session.
Экспериментальные работы. Нашей задачей является
Our task is to show students that research is not difficult, that they will use the results of research on. The course lasts 1 semester and consists of 17 seminars and 7 lectures. The course covers the basics of research activity.
данной дисциплины будет полезно не
It is
только
also
тем людям,
important to
которые
emphasize that this course will be
захотят
useful not
связать
only
свою
for those
жизнь
students who
с
wish to link their
медицинской
lives with
наукой,
medical science,
но
but for
и
absolutely any field of
абсолютно
medicine.
любой медицинской специальности, абсолютно любой области медицины. Особенно мне хочется остановиться на мерах
I would particularly
социальной
like
и
to highlight the
материальной
social and
поддержки
financial
студентов и
support for
молодых ученых
students.
нашего университета. Мы понимаем, что без должной материальной поддержки
Without it, we will
мы
not
не
be able
сможем
to attract
привлечь
new young people into
новые
science.
молодые кадры в науку, в занятия исследовательской деятельности. Первое – это персональные стипендии
The first
студентам
is
и
personal
аспирантам за
scholarships for
достижения
undergraduate
именно
and
в
graduate students for
научно-исследовательской
their
деятельности.
achievements in research activities. Chancellor's Scholarship, the Academic
для
Council's
студентов и
Scholarship,
аспирантов. Это и стипендия ученого совета, это и билет
the
студента-исследователя.
Student Researcher's
Особая
Card, which is a
награда,
special award
которая
that is
выдается
given to the most 20 outstanding
наиболее
researchers.
отличившимся в исследовательской работе студентов. Этот билет студента-исследователя также является дополнительным
This is
стимулом
motivation for students.
студентов заниматься исследовательской деятельностью. Гранты 150 тысяч
A
рублей,
grant
это
of
порядка
150,000 rubles, which amounts to about $2,000 US. This is a grant to conduct their own first real research. Of course, it is payment for training and internships, if it is necessary in scientific activities.
Стажировок, если это необходимо студентам или молодым ученым в своей непосредственной исследовательской деятельности. Подводя итог своему выступлению,
To summarize, I would like to outline the three most important blocks of work.
наиболее важных блоках работы. Первое, нужно понимать, что развитие науки
The first
абсолютно
is that the
невозможно
development of
без
science is
кадрового
absolutely
обновления.
impossible without human resource renovation. It is the new researchers, new ideas, and scientific discoveries.
Второе, чем раньше студент найдет себя,
Second, the earlier student finds himself or herself, the more effective he or she will be able to become a successful professional.
успешным специалистом. И, конечно, персональный подход, персонифицированный подход
A personalized
это
approach
залог
is the key to success.
успеха. Это наиболее сложный путь, но как
This is the
по
most
нашему
difficult way,
опыту,
but in our
наиболее
experience, it is the most effective one.
Мне очень нравится фраза, что
I like the
каждый
phrase
профессор
that every
был
professor was
студентом,
once a student,
но
but not
далеко не
every student
каждый
will become a
студент
professor.
станет
And our mutual
профессором.
task
И
is to
наша
make a number
общая
of professors
задача
at our university greater.
это сделать так, чтобы профессоров в наших университетах становилось все больше и больше. Благодарю вас за внимание.
Thank you for your
Я
attention. I am
очень
very grateful to have a chance
рад
to present my
еще
case
раз
here today.
благодарен вам за возможность выступить на сегодняшнем семинаре. Наше научное общество молодых
Our School of Young
ученых
Researchers is
открыто
open for you.
к новым контактам. Большое спасибо. Я готов выслушать ваши.
I'm ready for your questions, and I will be happy to.
Thank you very much to Associate Professor Dr. Lipov. On behalf of Professor Dr. Lipov, we would like to say sorry for the inability to join and live. However, we will share the email for any participant who would like to ask directly to the email for the question. Thank you very much. So now we will proceed with our fourth plenary by Associate Professor Dr. Akish Nazarian. So I will read CV first before we invite her to deliver her plenary report. Associate Professor Dr. Akush Nazarian, he is a candidate of medical sciences, head of a laboratory for 3D modeling of the human body of the Center of Scientific and Technological Research, Bionic Engineering in Medicine, project manager of the Research and Development Institute of the Samara State Medical University, associate professor of the Department of Operative Surgery and Clinical Anatomy with the course of Innovative Technologies, senior researcher of the leading research center of the Samara State Medical University. He also head of the 3D modeling direction at the Institute of Innovative Development of the Samara State Medical University. He is also author of more than 120 scientific publications, including 12 scientific manuals for students of medical universities, 2 teaching aids one monograph, 10 articles in journals peer-reviewed by Scopus and Web of Science, more than 100 articles in Russian scientific journals, statistics from journals reviewed by the highest accreditation commission of the Russian Federation, 28 certificates of state registration of computer programs, and 4 certificates of state registration of databases. So without further ado, I would like to welcome our Associate Professor Dr. Akif Nazarian to deliver her support plenaries entitled Pirogov Anatomical Table in Anatomical Teaching and Learning. Kindly please welcome. Thank you. Excuse me, Prof. Akif. I tried to unmute this. Can you test your mic first? I tried to unmute yours. Prof, can you hear my voice? Sorry, we have a technical problem now. I tried to get Prof Akif to get to have his mic now. Prof Akif, can you try to use your mic? We can't hear you yet.
First of all, I would like to thank the conference organizers for the flow.
Sorry, can you unmute your mic first? I tried already for you just now. Can you hear my voice, Prof Akif?
Can you hear us?
Yeah, now can, clear. Your audio visual can, clear, fast, thank you.
Thank you. Okay, good day, dear colleagues. First of all, I would like to greet all participants of this conference and thank the respected conference organizers for the floor and for this opportunity to present and share experience on behalf of the Samar State Medical University. The Samar State Medical University is one of the leading innovative universities. The university is engaged in unique developments in healthcare. Let me introduce myself. My name is Associate Professor of the Department of Operative Surgery and Clinical Anatomy with a course of Medical Information Technology of the Samar State Medical University. I also head of laboratory for 3D modeling of human body of the Center of Bionic Engineering in Medicine. Today I will present one of our developments and the new learning paradigm that we have developed using 3D technologies in remote format during the COVID-19 lockdown period. Samara State Medical University. Next slide.
from Akush.
Sorry, I
Can
will
you hear my
provide.
voice?
We try to.
We lost your audio just now.
I can click. Okay.
It's okay. Go. Take your time. Yeah.
Yes. Samara State Medical University has established, introduced a new learning paradigm. The theoretical part lecture take place in the distance format with invited speakers, including the world-leading teachers and scientists from overseas. In order to develop practical skills, the university used the simulation center, equipped with modern training devices and simulators, the Pirogov Interactive Anatomy Table, VRR simulators developed by the Samara State Medical University. Practice takes place in the cadaver center using biological material, while surgical training using animals and is in the wet lab center. The last step in this process is practice in a clinic in real bedside routing. One of the projects that we took active part in the development of the Pirogov Interactive Anatomy Table and software. We take part in the development of Pirogov 3D Atlas since 2013. And of course, being one of the creators of this technology, we have been actively using in our education process. It has been introduced in our education process in 2015, and since then has been an integral part in our university. More than 10,000 students have completed training using Pirogov Interactive Anatomy. Just a few words on how we use Pirogov in the educational process in Samara State Medical University. Pirogov is used in different forms and for solving various problems and reaching different goals. Teaching in class and distantly, working groups and individually, using for macro groups, seminars, conference, workshops, individual work using Pirogov Anatomy app for Windows, iOS, and Android. It gives opportunity to create anatomy sense, share them with students, assist them and receive provide a segment back on your devices or anatomy table. The interactive anatomy table and the Pirogov Anatomy 3D Atlas are used by students of different years at the following departments of Samara State Medical University. Department of Operative Surgery and Clinical Anatomy, course of Medical Technology, Human Anatomy, of Histology and Embryology, of Hominal Physiology, of Pathological Anatomy and Pathological Physiology, of Neurology and of Surgery. The development of new models enable to expand the area of application of the Pirogov Anatomy Interactive Anatomy Atlas. One of the main courses in Russian medical universities is topographic or clinical anatomy and operative surgery. It has been founded by the prominent Russian surgery Nikolai Pirogov. By the way, the interactive table and atlas were named Pirogov to honor his name. Starting this course, students come across the problem of understanding the mutual arrangement and opened interrelation between organs and tissues by means of the human body. The purpose of the course is anatomical and surgical training of students required for proper students and clinical departments and independent medical practice. Pirogov Anatomy supports of complete learning process cycle within the mentioned course from visualization and anatomical objects to verification of quality of obtained information. In the late 2019 and early 2020, the world faced the COVID-19 pandemic. Just like universities all over the world, the Samara State Medical University was forced to switch to distance learning. This was a first preventive measure to avoid the distribution of dangerous coronavirus infection. The university needed a solution that could quickly replace to the advance of biological materials at students of anatomy and establish contact between students and teachers at the process of studying and assimilation of educational material. Pirogov Interactive Anatomy 3D Atlas has become such a solution as it allows students manipulation with a virtual human body in a remote format from the teacher's PC through Zoom, Microsoft Teams, and so on. After the first COVID-19 wave in Russia in 2020 and the transition of universities to distance learning, the Samara State Medical University started effectively of the use of Pirogov 3D Atlas during practical classes held in a remote format. The purpose of the study was to evaluate of efficiency of the use of the Pirogov Anatomy 3D Atlas during practical classes in the clinical anatomy and operative surgery course held in a remote format. The Pirogov Anatomy 3D Atlas has been used to reach this goal. Third-year students have been working according to the practical session plan. 260 third-year students of the Institute of Clinical Medicine and the Institute of Pediatrics have taken part in the study. The efficiency of the use of the Pirogov Anatomy program in the remote format was assessed following to results given during online classes on the surgical neck anatomy subject. Two groups have been made. The first group included 132 third-year students, 78 students from the Institute of Clinical Medicine, and 54 students from the Institute of Pediatrics. After independent theoretical training, the students have worked in class in a video conference format using the Pirogov Anatomy 3D Atlas program. The second group consisting of 128 third-year students, 76 students from the Institute of Clinical Medicine, and 52 students from the Institute of Pediatrics. The group has completed theoretical training without the Pirogov Anatomy Atlas program. Upon completion of the cycle, both groups have been tested in the university electronic system. The scores have been registered automatically. The results of the assessment are presented on this slide. As you can see from the test results, the group in which Pirogov Anatomy was used shows the better test results in assessment. Apart from assessment, all the students that have completed training using the Pirogov Anatomy 3D Atlas during that period have been survived. 260 students have taken part in the survey. 107 young women and 84 young men, age 20 to 22. It is worth noting that 84.6% of students have assessed their level of satisfaction from participation of the program is high and very high. We have not received any negative feedback. Presentation of a program has been assessed in a similar manner. The students have expressed a high 92 and very high 7.6% opinion of the teaching methodology. Following the carried study, it should be not that the Pirogov Anatomy 3D Atlas is suitable for students studies for topographic or clinical anatomy and operative surgery in remote format. It helps students get a better idea of completed three-dimension arrangement and of the relation between all organs, human organs and system. It allows student manipulation with a virtual human body in a remote format from the teacher's PC. It is a suitable alternative of traditional dissection, as it gives an opportunity of multiple deletion and exposure of soft tissue in a human body layer by layer, shows in the interrelation between organs, vessels, and nerves. The Pirogov Anatomy 3D Atlas supports the complete learning process cycle within the clinical anatomy and operative surgery course, from visualization of anatomical subject to verification of quality of obtained information and further automatic processing to test results. I would like to add a few words about the functionality of Pirogov table and Pirogov Anatomy app for medical education. The solution consists of the 3D anatomy table Pirogov and a set of Pirogov Anatomy app for lessons for students and teachers of personal devices. The technology allows digital dissection of a body in actual corneal and sagittal plans, teaching anatomy by layer, by system, or by body part. Zoom in our height and delete object or return to plans, make organs and system transparent. Draw with a pen and share sense, study system. Compare health and pathological enhance your students' understanding of ultrasound, CT, and MRI. Pirogov anatomy tables are installed in 180 plus medical universities in Russia and former Soviet Union countries. Last year, the Pirogov anatomy tables began to be used in universities overseas. In the University of Luxembourg, Wien University, Ho Chi Minh University, Hanoi University, Phoenix University. For 2022, it is planned that the technology is expanded to India, Thailand, Turkey, and Middle East. In case you would like to have a closer look at this technology, please contact Pirogov. Their contacts are at this slide. As my report draws to a close, I would like to once again thank organizers of this conference, and I take this opportunity to also invite you to the conference 3D Technologies in Clinical Anatomy that Samara State Medical University holds in September. This conference is planned to September 2022, both in the offline and online formats. We would like to invite you to take part in our event. Thank you for attention. I would like to glad to answer any questions that you might have.
Thank you very much, Prof. Ashok Nazarian, for your kind sharing. Now, we open for the participants to ask any question. Okay, Dr. Norida asked in the chat box, Prof, how is the pricing for this Pirogov app? Vigorov, sorry. The price? Can you hear my voice?
Distribution in Malaysia, and you can ask him for the prices.
Thank you, Prof. Alkush Nazarian, for the answering the question. So, any plan to come to share to Malaysian medical universities in next year? Okay, if any more participant would like to ask question, can direct unmute your mic and can ask also Prof. Alkush, or you can type in the chat box.
Chat box. I don't
Can you hear my voice? You can hear? Any more questions from all participants to Prof. Alkush Nazarian? Prof, can you hear my voice? I think we have a technical problem a bit now. Okay, I hear my voice. Prof already put in the chat box. So you can address Pirogo for detail on prices for Malaysia. Pirogo also have a distributed in Malaysia. Okay. Okay, thank you, Prof, for your kind sharing and response to the question in the chat box. So, on behalf of organizer, I would like to thank you very much for your kind accepting our invitation. Nice to meet you virtually. Hopefully, we can collaborate in the future as well as the medical university in Malaysia. Thank you once again. Okay. Have a nice day, Prof. Okay. We will proceed with our fifth plenary for today. Our next plenary speaker is our medical lecturer from University of Malaysia Sarawak, UNIMAS, Dr. Angela Siner. She will share the topic of undergraduate medical student research. Before that, I will read a bit on her CV. Dr. Angela Siner is the head of department, senior lecturer, Department of Basic Medical Sciences, Faculty of Medicine and Health Sciences, University of Malaysia Sarawak, UNIMAS. She also a course coordinator MDP 20505 for elective 1 research for undergraduate medical second year and research fellow Malaysia Research Centre for UNIMAS. He received academic qualification PhD Medical Biotechnology in 2013 from University of Malaysia Sarawak, Master Science Toxicology in 2002 from University of Malaysia Sarawak, from University of Cincinnati, and Bachelor Science of Honours Biochemistry in 1995 from University of Wales. She also a supervisor for main supervisor for 3 postgraduate students, co-supervisor for 2 postgraduate students, and supervisor for more than 20 undergraduate students. So we'd like to welcome Dr. Angela for deliver her presentation entitled Undergraduate Medical Students Research Project of UNIMAS. Please welcome. Thank you.
Very good afternoon to the committee for the symposia. Thank you very much for inviting me to give a brief overview of the types of projects that medical undergraduate students undertake at our Faculty of Medicine and Health Sciences, University Malaysia Sarawak. So the elective one, or MDP 20505, is the name that is given to this course that is undertaken by the medical students who are in the second year of our 5-year medical program. In this course that they are taking, it is compulsory because despite the name elective, that has some more to do with the tradition of the medical school that is based on a British program. So even though the name is elective, it is actually a compulsory course that all medical students have to take, but in our case, during the second year of their studies. But this course is slightly different from the normal subjects that they take, because this course is undertaken at the same time that they're doing those other courses. So they don't have any special time in the timetable that is given to them for this course. So they have to find their own time and plan their own time when they want to achieve the various goals for this course. And the other thing to note is that this course, although the academic calendar is 12 months, but for this course it's only 9 months, because they have to include and take into consideration the time that they need to prepare for their exams. So they have other exams throughout the second year, and so they need to take this into consideration when they're planning their research activities. The other thing to note about this course is that the main objective of this course is that it is to give them exposure to what is research, to what research is all about. So since they have never taken any research projects before, this will be their first time. So the students are a bit different from other students who do research, in the sense that these second year students are like a blank page. So they need a lot of guidance before they start the project, during the project, and also to wrap up their project. And then another thing that's unique about this course is that it is not done individually like in other faculties, and it is not done at the end of the year, because like at the end of their studies, like in other faculties. So in this, and so in this course they do it group 3 or 4 students, because mainly because we don't have enough facility and for the students to be reduced into groups of 2. But we never know, maybe in future, if and when we have enough, this is a possibility. But the main thing is that this is a project, of course, that is undertaken based on teamwork. So how do they do the project? Well, in the beginning, first of all, they need to find out who they would like to be their supervisor, or to give them guidance as they undertake this course, and also to decide together with the supervisor a suitable topic. So in the years that we have conducted the course, that we have made lists of previous supervisors and previous projects. So every year at the start of this course, this information is made available to the students so that it can give them some idea of what has been done and what can be done. Then the next step is after they have done this, then they need to write up a research proposal, and the research proposal has a specific format of what are the required components that must be in the proposal. And after they have written this proposal together with the guidance of their supervisors and co-supervisors, the students need to defend their proposal. And the reason for the defense is to make sure that the project that they are proposing is feasible, and feasible not just in terms of the data that they'll be collecting, but also in terms of the budget that they may have to prepare for, as well as the timing of the project, so that they can finish the project within the 9-month period that they have. So after they have defended the proposal and they have made the necessary corrections, then the next thing they need to do is to make sure that they have the necessary permissions. So if, for example, if they want to do a survey in a school, then they need to have ethics approval, first of all, for the survey form, followed by a letter or requesting permission from the education department, followed by permission from the headmaster of the schools that they're going to survey. So this is just one example. If it was a lab project, then it depends whether the project involves human subjects or animal subjects, or biological, like plants. Then they need to write to the relevant authorities for permission as well as ethics approval, followed by writing to the head of department for pathology for bench space, and also if they need any assistance from our medical lab technologists. And as soon as they have all the permissions, then the next thing they do is they do their project and analyze their results. And at the end of this 9-month period, they will be assessed on how to communicate their findings. So, and that will be the end of this course, which is how do they communicate the findings. We have 3 different formats. The common formats that is done everywhere by researchers, and that is writing a report. So that is a written communication, and they will also present. They will also prepare a poster, which is another form of written communication, and they will also have, lastly, an oral presentation, which is to give them exposure on how to communicate your findings in an oral format. So between the years 2016 and 2020, I've chosen this small window of time as opposed to a longer one, just to give you a highlight of the subjects of our students' research here at UNIMAS. And as you can see here, most of them are based on, they do their projects on non-plants, meaning probably may or may not have known, Malaysia is rich in biodiversity. So there are many plants that is associated with medicinal value, and so naturally there would be some interest in trying to find out the effect or the uses of plants. But there are also other things or other subjects that are of interest to our students, and that include color therapy for health, for example. So that would be non-plant, and because it involves the response of humans, so that would fall under a human subject. Other examples of non-plants would be studies using looking at the at the prevalence of, for example, vaccination. So they would be fall under non-plants. And of course, there was one between this year 2016 and 2020, where it involved an inanimate object. So it didn't fall under plant, non-plant or human. Handphones, effect of mobile phones on lifestyle. That's just an example. So if we look at the types of supervisors that they have, our students have been supervised by, in general, 3 different groups of supervisors. So most of our supervisors come from the phase 1, because the medical program is divided into 2 phases. So before, the first 2 years are known as the preclinical phase or phase 1. And then after they've taken their first professional examination to show that they are competent to move on to the clinic to do their clinical based studies, so that which is known as phase 2 or the clinical phase. So the phase 1 obviously are the non-clinicians. So these are the main bulk of our elective 1 research supervisors, but we also have colleagues from phase 2 who also participate in our student supervision. And lastly, I would also like to highlight that we also have colleagues or collaborations with colleagues outside of UNIMAS in their research in our projects, and so I've put them as non-UNIMAS. So these are the 3 different groups of supervisors we've had so far. So at the moment, our non-UNIMAS supervisors come from, for example, other local universities. There's one example, or they come from other healthcare facilities. For example, one of our colleagues, Professor Henry and Madam Teh Xiaoping, they collaborate quite frequently with colleagues from local private hospitals, because Prof. Henry is also involved in the care of patients in that facility. So we have this type of supervisory team as well. And so if you recall earlier, I mentioned that the students do not have a background at all in how to conduct research, and their supervisor providing introductory lectures on certain key topics, and also hands-on session on the use of SPSS. But these are all introductory and very basic. So the main bulk of guidance to the students ideally would be coming from their supervisory team. In terms of assessment, the students are assessed in 2 ways. One is a continuous type of assessment, and it is provided by their peers, of how they would rate each other's performance, and also from the supervisor, the main supervisor, because as I mentioned earlier, the supervisory team may consist of one main supervisor but several other co-supervisors, but only the main supervisor is expected to rate the student's performance. So this is one mode of assessment. And then, of course, as I've also mentioned previously, they also have the communication type of outcomes that need to be assessed. So in this case, the proposal, the report, the poster, and the presentation. So these are the various assessments that the students will be they will be used on the students. What are the types of the projects that students have done throughout these years? And this is not just referring to 2016. This is referring to between 2004 until present date. So in general, we can say that the students undertake one of the types of projects that undertake is lab-based project, and we call this lab-based because they would do experiments in either in our own lab or at a collaborators lab. And here I've taken an example of one of the projects that have actually been published. So there are projects that have been published, and this is by Dr. Zunika and her students, and it was on boric acid. So this was one of the non-plant subjects that was lab-based project. But quite a number of the students actually prefer to do non-lab or survey-based projects. And I've taken here a project that is done by Dr. Tin, who was the main supervisor, this is a special group because in this group, Dr. Tin was the main supervisor, but Prof. Marina was one of the team of co-supervisors. So this group was led by a supervisory team, and they did the project during the COVID pandemic. A very interesting project. Probably you might want to look it up if you have time. And their students' work has been published in the journal e-learning. So these are the two very common types of projects that the students choose to do with their supervisors. But having said that, there are also other types of projects, and in this case, we have also had students and supervisors choosing to do projects using internet, ICT, IT technology. That means using information from a database and analyzing this information using free or paid software. We have, and for example, the database that they've used in one of the projects was the DNA sequence from GenBank, and they were analyzing polymorphism in this sequence of genes from parasitic organism, and to see whether and to study and analyze the characteristics of this DNA sequence. We have also had students having access to patient database, either to Ministry of Health Malaysia database or the private hospital database. And then analyzing retrospectively these patient case notes and looking for answers to their research questions. Lastly, more recently, this is another type of project that our students have undertaken, and that is in accessing patient database or publicly available genetic sequence database. The students instead have research questions that require them to analyze data that is obtained from search engines. For example, PubMed or Kabi and so on and so forth, in order to answer questions that lead them to produce scoping review, for example, or to do a meta-analysis, for example. So these are the the other more recent types of projects that the students have done. And oh yeah, I forgot to mention that because of the pandemic, COVID-19 pandemic, the students were not on campus for these 2 years, but they still need to take the course. So due to this limitation, obviously lab-based projects were not feasible, and survey projects using paper-based was also no longer feasible. So for the past 2 years, our students were given special permission. They were allowed to do their projects online. So they were doing their surveys using Google Forms and so on and so forth. And also there were no wet lab projects. And so that was where these other types of projects became the main types of projects. But that was for these past 2 years. But now that the students have been allowed back on campus, so I foresee that some of our phase 1 lecturers would like to, and also some of our students would like to choose to do lab projects. So we will see more lab projects now that they are available, that students are back on campus. And so if you look here, what I did, as I've done before, just to give you an overview of how many projects are lab or non-lab, I've included the human and whether it was, if it was a prospective study, for example, blood sampling type of projects, then it would involve lab work, so they fall under lab. But if it was just prospective studies involving human but does not involve lab work, for example, involving the simulation lab or involving the physiotherapy lab, then those would fall under non-lab. So as you can see here, our students prefer, but that's a bit more non-lab versus lab. But I think this, of course, this one has to be taken with into consideration that 2022 and 2021 projects were mainly non-lab. So that could be the reason why there's more non-lab than lab. So this was just to remind me that when they submitted their reports, it used to be in hard copy form here. But because of the pandemic and the students are not around, even the staff was not even, we were working from home sometimes. So our reports now are fully online, submitted online and corrected online. So we no longer use paper format like this. The other thing that has changed due to the pandemic is that posters. We also have posters, so no longer have a physical poster, but we have soft copy of the poster, PDF of the poster, and submitted online, corrected online. And lastly, the presentations. We don't have an actual face-to-face oral presentation, but we do it using online platforms. So this is a screenshot of one of the students' PowerPoint that they were showing during the oral presentation that was conducted online. So to end my very brief presentation about research done at by the Faculty of Medicine UNIMAS students, I would like to acknowledge our colleagues who started the course. So this course started when the Faculty of Medicine started, which was in 1994. I think 1995, sorry. Our first batch of graduates graduated in year 2000. And the course founder was the late Professor Vijay Tambiraja. He's biochemist professor. And at that time, the course was just 1 credit, and it involved literature review. And when Professor Shafiq and Dr. Isabel took over in 2006, the course evolved into a 5 credit course, which is what it is now. And the assessments also has evolved into the mode that we have now. And since then, the course was coordinated by Dr. Zunika, and I took over from Dr. Zunika. And lastly, I would like to also acknowledge the contributions, the tremendous contributions of our colleagues, our support staff, and as well as our students, because during the COVID pandemic, a lot of the surveys it was no longer feasible to conduct surveys, for example, in schools or in the general to the general public due to the limitation of access to these study populations. So quite a few of our students had to limit their target population to our own faculty students. So without them, the elective students would not have been able to finish the projects. Thank you very much for your time, and thank you again to the committee for inviting me to give this talk.
Thank you, Dr. Angela, for the kind sharing on the topic plenary for today. So we will finish our symposium the last plenary before we having our closing ceremony with our dean, Professor Asri. We would like to read their CV first. I will read for the participants go CV for Professor Dr. Larissa Udokina. She is a Doctor of Medical Sciences from Volgograd State University, Russia. Candidate of Medical Sciences, St. Petersburg State Pediatric University, Russia. Graduated from Astrakhan State Medical University in 1986. After graduation, she worked as a researcher at the Central Research Laboratory of ASMU, Astrakhan State Medical University, since 1989. She worked at the Department of Anatomy as a teacher, associate professor, head of department. For 6 years, she headed the Faculty for General Medicine, the largest one of the university. Currently, she is the head of the Department of Normal and Pathological Anatomy, Vice Rector for International and Interregional Activities of the Astrakhan State Medical University. Her main scientific interests are age-related anatomy and biomechanics of the musculoskeletal system, preclinical medical and anatomical education. Our second speaker, Associate Professor Dr. Matthew Rizno. He obtained his PhD from Volgograd State Medical University, Russia, graduated from Astrakhan State Medical Academy in 2008. After that, was a postdoctoral researcher at the Department of Human Anatomy. He worked as a teacher, senior lecturer, and then associate professor at the Department of Normal and Pathological Anatomy of Astrakhan State University. He also a member of the Russian Society of Anatomists, Histologists, and Embryologists. His research interests are aging process and mathematical modeling. Published 3 papers in Scopus, Web of Science, cited journals, books, and more than 40 papers in local journals. Without further ado, I would like to welcome both our speakers, Professor Dr. Larissa and Associate Professor Dr. Matthew Rizno. Kindly welcome. Thank you.
Good morning, everyone. Can you hear me?
Yes, good morning, Prof. Yes, we can hear you clearly. Audio visual clear. Thank you.
Thanks. Oh, wait. Yeah, we have a morning. You have it's an afternoon. Good afternoon, I suppose. So I would like to share our experience about extra class activities, which is the Olympic competition. It's a kind of competition which I will describe next. So, pardon. So, as you know, the natural expansion and modern condition of business, economic, and cultural contexts, with one hand, it will simplify the learning process, giving the students the abilities, the free access of original professional-oriented materials. On the other hand, it's precisely such wide possibilities of using wide variety of sources that force us teachers to improve our methods and teaching to order to constantly maintain the interest of our students and discipline that been studied. So, but we found that the students of the first and even the second year often call the subject of anatomy a complex and frightening subject because they don't know Latin words, and the anatomy course demands high requirements to knowledge and learning skills, of course. The perception of anatomy by this way, of course, leads to demotivation of students, reduce the knowledge abilities, and other problems. One of the possibilities to influence affect on this class is out-of-class activities. There is many forms of these out-of-class activities, which is in a uniformal setting, and it could be, of course, the gamification of learning, different kind of homeworks, and but today I would like to present a quite specific type of activity, which is the competition strategy in education. So we found that this thing improve the students' creativity, collaboration, communication, and critical thinking. Of course, it's important cognitive skills that are essential to success in anatomy course. It's for my colleges who are not from Russian-speaking countries, we call such competitions like Olympiads, like the sport competition, but in educational way. And it's more oftenly looks like a group of 3, 5 maybe students from one faculty, maybe from one university, involved in the competition between faculties, maybe other universities, and even the countries. And most often the reward is not some prize, it's mostly the participation itself and the feel of victory and success. About some history details, the movement of Olympiads in educational way, it's born in the beginning of the 20th century. It's in synchronism with the revival of philosophy of Olympic competition and sport. And in our country, the first educational Olympiads begins from school. It happens in 1935 in Russia. The first Olympiad was mathematics, and it was the way how to find the talented students, talented persons, and so then the Olympiads quickly spreads into the other fields, also the students' fields, the medical schools, and in the beginning there was informal without strict rules and other things, but then at 1946 the Olympiads was recognized by government and it becomes official way how to find the talented students. And then after that, the Olympiads will looks like we know them right now. The competition, it could be at different level. The first is the Untitled Olympiads, which allows to find the talented students inside the specific university, maybe even the faculty. It's usually not so without strict rules. In informal setting, to find the students who wants to like expand their knowledge of anatomy, histology, and maybe other disciplines. And the next level after that, usually the students who pass the first level can be involved in the second and the third level of Olympiads, which will be a regional level when maybe the university of one city involved if they have similar disciplines, or the next stage is the university from different countries and maybe even the university from the same country, but which is quite distant from the base university. So the main reason why we do that is the proposed that Olympiads increase motivation to study of subjects, which is significantly increase the competitive element. The most important task of medical education is to improve training of specialists, increase level of professional knowledge, the formation of system thinking of students, and focus on effective use of acquired skills and future practical activities of these students. To help to identify the most capable students, as well as stimulate the in-depth study of discipline of professional model, we just, similar to the sport Olympiads, there is a different kind of activities inside the Olympiads, and mostly it's the group Olympiads, so the group of students will be involved in this competition. We choose the group because it's less stressful for the students, because when they only one, they feel the serious responsibility for university and or even faculty. And we know that the group activity is less stressful maybe for them. And maybe after that, they can use the individual way of competition. And of course, the participation of Olympiad is an act of goodwill of the students. We never force them to be involved in this moment, and our task is to create conditions for the students so to desire and participate in it. The prizes, as I said, they could be both material, of course, even sometimes it could be the cash, like money, but mostly it's diplomas and certificates of participant. And of course, the moral satisfaction of the students is the biggest reward that they have, and it only can be a result of hard work and personal experience for the student. As a positive effect, they're like a side effect of this competition. It's the involvement of mentors and teachers in that. Because the organization of Olympiads, they're always different. It's not just the tests. It demands the creative way and the creative like thinking how to make the interesting task and for Olympic movement. So the social activities during the Olympiads, we found that it's also a very important part of the Olympiad movement. So that the social activities between the groups, inside the group of the student, leads to the consolidation, increase the social experience, cooperation, and even it's increased the involvement in the medical education itself. The main principles of Olympiad tasks. So as I said, mostly, yes, the Olympiads looks like that. It's quite old photo taken more than 2 years ago before the pandemic. You can see a lot of students here without masks. So usually it's a group of 3 or 5 students, and they could be from different faculties. It doesn't mean they're all from the same group of educational group. This way is face-to-face Olympiad competition, when the group solve some tasks, and then these tasks evaluated by points, and according to these points we choose the winner, somewhere in between, and some sort of losers, I suppose. So of course could be a distant format. We just use this also. It could be a distant format, or it also could be a mixed format when some students are presented here in the university and some is online from other universities. It's also possible, and we find that this way is also quite good and don't lead to any serious limitations. The groups, as I said, can vary from 3 to 5, even more persons, even could be 10 persons. And different kind of Olympiads can be only group activity, when only the group is responsible for the tasks. They solve some clinical tests together. And so the points that they get it's group points. Sometimes the tasks demand only one person, specific person, and they can choose who will be at this moment. But the points that they give the personnel goes to the group points, and in general, then it's just the individual task effects on the group evaluation. And of course, could be a mixed way of this, as usual. The usual structure of Olympiads is, and the competition is the first stage, the first part is the test. It's quite classical test with a complicated, mostly it's a complicated questions. With a, it could be with a multiply choice, only one option and many other ways, but it's a quite simple for high-level students, let's say. And the task of the aim of this, the purpose of this stage is to like heat up the competition itself. The second stage is the clinical task. It's a difficult clinical task from the different fields of medicine, and it's based on the deep anatomical knowledge, and also many other disciplines is involved in that. It could be surgery, it could be physiology, could be many other things, and of course these tasks will be evaluated by this task will be evaluated by points from 0 to 10. Yes, these tasks also will be depends from how, like what kind of students is involved in this competition. First year students, of course, won't be involved in the Olympiads where the surgery and other tasks presented. So second, third year students also could be involved in the surgery Olympiads and other competitions. And third stage is the various tasks. They usually changes from one competition to another. It never just the same. And on this slide, you can see like the hand of ancient sculpture. And one time when we was like organizers of one of these Olympiads, we give the task to recognize the muscles, veins, and arteries which are presented on these antique sculptures. And it was the task, so we just choose like also by points, and even it's like more increased difficulty. That's why there are more points for these tasks. Yeah, as I said, we were organizers of competitions many times, and our department participate in other Olympiads starting more than 50 years. We organized competitions in the Russian language, but since the Russian student, we have more Russian students than foreign students. And of course, many Russian students wish to involve in that. And but we make some small Olympiads to solve all from these students can be really involved in that. For English and French speaking students, they usually those who wish to involved in that, please problem they can be and they can be involved in that. So it's missing slide. The main feature of the medical Olympiads is that the participant must demonstrate not only the knowledge of medical science, but the whole spectrum of natural science. When in case that there is a different educational university, the Olympiads usually held on the base of this specific university, and this university will share the rules for others, that these rules should be strictly structured and described, that everybody knows what they face. And all of this is to ensure about like a fair game and where the rules are clear for all participants. But of course, we don't share all questions and all tests, which will be, but examples of these tasks and tests is necessary. So everybody should know what kind of tasks will be in the future Olympiads if they want to be involved in that. So usually, of course, mentors and the teachers who usually together with the students, they're not allowed to directly participate and influence on the decisions of their teams during the Olympiads. But it doesn't mean we just don't make any discussion. Often after each of such events, teachers informally discuss the task and the points and the evaluation of points. And it will optimize the future Olympiads. As a result, the cooperation between teachers and these type of competition also involve the teachers themselves and will stimulate the teacher to improve their to generate new ideas and stimulates to search new approaches to implementation tasks and to make this curriculum. So thanks for your attention. We're happy to invite to your conference. If you have any questions, you can ask.
Thank you very much, Mr. Professor, for your kind sharing. Probably I would like, we're waiting for other participants to ask questions in the chat box or unmute your mic. Can I ask one question to Prof? Do you have any rubric regarding the choose, how you say, the most talented students, right? Do you have any rubric for your assessment and choosing the students? Thank you.
Can you repeat just some problems with internet connection?
I'm sorry. My question is, since you shared just now that you will choose the best talented student, right, for the competition. So among the faculty level or university, do you have any rubric that you choose your student from?
So we have different approaches to that. So we usually choose the group of students by, yes, talented students and not experienced students, because the competition is quite difficult. And if the group of students are 5, so some of them is just the beginners, some of them usually experienced students. And yes, by this way, we just find the students by this way. Yeah, of course, one of the prizes for talented students is to simplify their future exams for anatomy, and if they have a good results in competition, we just release them from any exams in anatomy course. I hope I just understand your question clearly, so and you're satisfied.
Thank you. You answered my question. Thank you very much, Prof, for your kind sharing and response to my question. So anyone of the participants would like to have any question, you can type in the chat box, or else you can also unmute your mic and ask directly to Prof for your question. So Prof, for the COVID-19 challenge and for the pandemic recently, right? How the students cope with the all, especially during the 2 years in the COVID-19.
How they involved in the COVID and pandemic way. So mostly, yes, we just switched to the distant format. What it's no other options was, as you know, but before the pandemic, before all of this, it was only face-to-face Olympiads, and now we just realized that the distant format is also okay, but there is some limitations because the distant format means yeah, we found that some students try to cheat because of that. You know, the field of view, you don't see everything what the students do, and some of them try to cheat, use some Google and other things. So, but we found the way how to solve this problem also. So.
Thank you very much, Prof, for your kind explanation and response for my question. So on behalf of organizing committee, I would like to thank you very much again to Prof. Would like to accepting our invitation and join us for today's symposium. We wish that you are in a great health, and also we'd like to have a collaboration in future for maybe for next and also future symposium. Thank you very much again.
Thanks.
Okay. To all participants, I already shared in the chat box for the attendance and the feedback link. Kindly fill up for our future improvement for the next symposium. With us now is our invited special guest for closing ceremony, Dean of Faculty Medicine Health Sciences from UNIMAS, Prof. Dr. Asri bin Said. Before I welcome him for the closing ceremony speech, I would like to read his CV. He's a Professor Dr. Asri bin Said, Dean Faculty of Medicine and Health Sciences of University of Malaysia Sarawak UNIMAS. He also a professor in the Department of Medicine, Faculty of Medicine and Health Sciences UNIMAS, and a consultant cardiologist at Sarawak Heart Centre, Kota Samarahan, Sarawak. His area of research interest include acute coronary syndrome, recovery from acute myocardial infarctions, biomarkers, and imaging. Together with the Kota Samarahan Health Centre, he has participated in over 20 phase 3 to 4 commercial clinical trials. He is currently also active in investigator-initiated research with areas of interest in post-myocardial infarction imaging and genetic biomarkers. His current work focuses on biomarkers for coronary artery calcification together with University of Surrey in UK. He is also a fellow of National Heart Association Malaysia and a committee member for Kenyalan Medical Foundation. Without further ado, I would like to call upon our special speaker for today, special closing ceremony for today, Prof. Dr. Asri bin Said. Please welcome, Prof. Thank you.
Yeah, thank you very much, Madam Chairperson. I think the introduction was elaborately long. I'm here just to for the closing ceremony. Well, first of all, I would like to thank the organizer of the Anatomy and Health Science Symposium for inviting me to officiate the closing ceremony of this symposium. I would also like to congratulate the organizing committee for a successful symposium. This is the first Anatomy and Health Sciences Symposium organized by UNIMAS. I do sincerely hope that in the future, a similar symposium can be organized by UNIMAS and it would be one of the annual event for the faculty. Yeah, I think this symposium is very important to increase everyone's understanding, especially the participants' understanding towards medical education, specifically in the field of anatomy. I expect that there was a lot of ideas and knowledge has been shared among the speakers for these past 2 days. Of course, the timing of the symposium have to be adjusted to the time differences. So in Malaysia, it's only in the afternoon. I hope with this new acquired knowledge, we can further enhance the quality of our teaching in the respective universities. I think everyone is already aware that anatomy is probably the oldest medical subject, and that is why it is given quite a focus by the organizer of this symposium. In addition, local and foreign guest speakers for the symposium that are invited has made this symposium a successful one. I hope that through this sharing by all the speakers, we will get a lot of benefit and at the same time improve in our knowledge of medicine as well as our delivery of how we teach our students. Just for everyone's information, UNIMAS has recently signed a memorandum of agreement with Astrakhan State Medical University and as well as an MOU with Volgograd State Medical University a few months ago. All of the international speakers for this symposium are from both of the universities. I would like to thank the speakers from both universities for their participation and making this symposium a success. I hope there will be more cooperation between UNIMAS and both universities in the future. It is to improve the medical curriculum in both countries. I would also like to thank our local speakers from University Science Malaysia, University Kebangsaan Malaysia, and University Sultan Zainal Abidin for their contribution to this symposium. Just before coming in, I was informed by the organizer that this symposium has achieved its intended objectives. And again, I'd like to congratulate the organizing committee for giving their full commitment in ensuring the success of this symposium. Now, last words from me, with the word of Bismillahirrahmanirrahim, I officiate the closing ceremony of the Anatomy and Health Science Symposium. Thank you.
Thank you very much, Prof. Dr. Astrakhan Said, for the kind closing ceremony. Now we would like to have the montage for today and yesterday for Prof. Astri and other participants to see for our symposium.
I hope that this symposium will be a platform for the academician to contribute their idea for a better implementation of medical curriculum globally.
Is a very important partner for Russia in Southeast Asia. Our relations are based on the long traditions of trust, mutual understanding and cooperation.
Speak today at the Anatomical and Allied Health Science Symposium, Medical Education in Malaysia and Russia. The presentations at the symposium highlight the importance of preclinical medical education as a core part of future doctors' knowledge. This is important for any medical education program.
This approach is due to the fact that practical healthcare requires a doctor to meet effective standards for treatment and diagnosis of diseases based on the principles of evidence-based medicine.
The learning begins not with a lecture but with a problem, a realistic and complex problem that is served as a stimulus for their thinking.
79 practicals, and there should be 65 hours of SDL.
Personal communication between different disciplines, this can be taught in surface anatomy.
Structures can be damaged if you go in this way. If you use another instrument, what will happen, and so on. And after that, the system gives you the feedback, explains you which mistakes were performed and how it can decrease the quality of the operation.
This is career guidance through our science, our project work, expanding their biomedical horizons. It is training them in public speaking skills.
Планы, которые позволили нам перенести клиническую часть занятий на период сегодняшнего дня, когда ребята фактически наверстывают те моменты в лечебных учреждениях, которые были не упущены, которые были отданы на симуляционное обучение, и сейчас они их отрабатывают в клинике.
Whatever you choose, review and evaluation must be done, because we cannot keep the same curriculum that was done like 30 years ago and then today it will become obsolete. And in order to produce a better medical graduate.
Cognitive competency, there are three main domains. Okay, mastery of anatomical knowledge, basic applications of anatomy knowledge, and clinical application of anatomy knowledge. And under psychomotor competency, identification of anatomical structure, 3D visualization of anatomical structure, kinesthetic appreciation of anatomical structure, and performance of anatomy-related clinical skills.
It is no secret that the need for highly qualified research personnel is increasing every year. This concerns absolutely all areas of human activity, from agriculture to nuclear physics. But it is particularly relevant for medical science. Why? I am convinced that the success of clinical medicine depends directly on basic research. Great medicine begins not so much at the patient's bedside as in research laboratories, because without basic discoveries, we would still be treating patients with herbal infusions and witchcrafts.
Anatomy 3D Atlas are used by students of different years at the following departments of Samara State Medical University. Department of Operative Surgery and Clinical Anatomy.
They are the non-clinicians, so these are the main bulk of our elective 1 research supervisors, but we also have colleagues from phase 2 who also participate in our student supervision.
On the other hand, it's precisely such wide possibilities of using wide variety of sources that force us teachers to improve our methods and teaching to order to constantly maintain the interest of our students and discipline that been studied.
Thank you very much for the kind symposium montage. So before we end our session for today, we would like to have our photo group session with our dean, Prof. Dr. Asri, to all speaker and participant, and also organizing committee. If you can open for a while your camera and give a big smile for attending and for organizing this first symposium. Okay. Can we have our technical team, Mr. Rowena, to stand by for photo group for last session for today?
Okay, please just again.
Tak boleh sebab memang tak boleh lah.
Mimi, kanan ke tengok Mimi?
You want a thumbs up, is it? Okay.
Yeah.
Okay.
Okay. 1, 2.
Okay, thank you very much to all.
Okay.
Thank you very much to Prof. Asri. Selamat sungkih. Okay. With that, we'd like to thank you very much, especially to our chairman for the first symposium, Dr. Saiful Bahri, and all the organizing committee. Hopefully, this is not the first symposium. We can arrange and organizing for the next symposium for future, and to have more collaboration with other countries from medical school. Thank you very much. On behalf of organizer committee, I would say thank you very much and also apologize for any flaws or technical glitch during the both day symposium. Okay, thank you very much. Stay safe, take care. For all the Muslims colleagues, we wish you a happy Ramadan and also happy Eid Mubarak. Thank you.